Hello everyone.
Hi.
Hi, good
Hi.
afternoon.
Hi Rupa मैम राजीव अग्रवाल सर है। हेलो सर। सर आप म्यूट पे हो। सर यू म्यूटेड।
Zoom does not want me to talk to you. Joking.
तो सर आप चालू करेंगे। आपके प्रशांत सर को हु विल स्टार्ट द
Thanks,
प्रोग्राम।
sir. We will start. We'll wait for 5-10 minutes, madam.
श्योर सर।
2:30 बजे का एग्जैक्टली क्या है कोई करता नहीं आता नहीं इसके लिए बिकॉज
हम्म।
वी हैड पेड 300 registrations.
ओके।
Forget the free part. और अब
ओके।
ये देखिए बात करते करते 50 का 80 हो गया. I'll
हाँ
just
हाँ।
because first talk was scheduled to be of Prashant. Hi Smriti madam, I can see आपका बाल अच्छा है मैडम.
Namaste, sir.
ज्वाइन करो. नमस्ते.
I will just check for presentation हो रहा है कि नहीं एक बारी कर सर मैं शेयर स्क्रीन कर सकती हूँ कि जस्ट चेकिंग क्योंकि मैं यहाँ पर एक अलग जगह पर बैठी हुई हूँ आई नीड टू सी हाउ द रिस्पॉन्स इज इट ओके इफ आई चेक
Yeah, madam, please, all yours.
इज इट विजिबल अनुजा
Yeah, it's seen.
इट इज विजिबल।
दिख रहा है ना और एक सेकेंड ना मैं अगर
एक
इसको
बार प्रेजेंट चालू कर देना, then you see.
हाँ अभी देखें हो रहा है ना स्पीड ठीक है
Yeah, proper.
ओके
Just keep your video off so that it will help when you're presenting.
ओके I'll keep the video off. Sure.
Is my PPT visible?
Yes, sir, it is seen.
Is Prashant logged in? So Prashant is joining in 2 minutes. So as soon as Prashant joins, we will start.
ओके सर।
I suppose the speaker the same what we had in HEALTHCON. Physical. Smriti madam was there, Sarang sir was there,
यस
Rupa
सर
madam
यस
was
सर।
there, and Anuja madam was also there.
Just Dr. Varsha will join from Vadodara. She wasn't there
Okay.
in the physical meeting, but she's taking one talk.
And since this is in two parts, we will have another part next month. So that will go in more details. This will cover the basics like we had done in HealthCon.
में क्या इंडियन मेंटेलिटी है कि 2:30 बोलेंगे ना तो लोग है ना 2:35-40 के बाद तो गूगल जूम का लिंक ढूंढेंगे एंड दे स्टार्ट लॉग इन बाय 2:40 2:45 तो मालूम है कि पहले 15 मिनट कुछ होता नहीं एंड दे कीप एवरीवन वेटिंग. Anyway, myself and Prashant will finish up in 20-25 minutes. Then rest is all yours. We had we have 301 in the morning. I don't know after that kitna hua registration. That these are the paid
Right,
registration.
sir. अभी तक 100+ have joined.
Hi, welcome all.
Hello, good afternoon, Dr. Prashant.
Good afternoon.
So Prashant, since you have joined, you can start. You are the
एक सेकेंड ना.
so till now 328 people have paid registrations for this HealthCon. So it was a very good response. So Prashant, can you just start? Because we were just waiting for you.
Yeah, sure. So I'll just share my screen. Where am I?
I'll just introduce Dr. Prashant Kerkar. He is our honorary dynamic secretary. He is a surgical oncologist by profession, practicing at Bombay Hospital, Khar Hinduja, then Bridge Candy, and many others. And he's a very renowned oncosurgeon and a very good human being.
Is my slide visible?
Yes, you are visible.
Are the slide visible?
Yes. Please go ahead, Prashant.
So I thank you to our dynamic and ever enthusiastic president, Dr. Rajiv, for introducing me. And first of all, I would like to welcome Dr. Sharang, Dr. Smriti, Dr. Anuja for joining hands with AMC for this wonderful HealthCon. I must share that we had a physical conference a few months back at IMA Jew Hall. And I personally, and I think a lot of people found all the talks very, very uh, interesting, engaging, and with a lot of wealth of information as long as regards nutrition. I've been in practice for more than 20 years now, but we are very, very conscious about the nutrition of our patients who are mostly cancer patients. But the kind of information we got during that particular meet was a wealth of information. I would thank all of you present here for that wonderful session that day. So with this, I will just come to talking to you about what is AMC for all those who are not aware. So these are the two faces who have been who have been on the forefront this particular year, 25-26, and me and Rajiv will be ending our term in the month of March. But we have had a wonderful time doing all these various organizations and collaborating with various institutions to hold webinars like this. I think Rajiv's introduction will be again there at the end, but since he introduced me, it is my duty to introduce him as well. So he is a very well-known pediatrician who practices in Mira Bhayandar area. He's had various roles in IMA as an honorary treasurer, past president of IMA Mira Bhayandar, and he has his own hospital there also, which is Shri Kasturi Medicare Private Limited, of which he is a medical director. I have already been introduced by Rajiv, but just to mention, I'm a surgical oncologist who specializes in hepatopancreaticobiliary and gastrointestinal surgery. And a lot of the surgeries nowadays are done by minimally invasive techniques. So coming back to our Association of Medical Consultants, it was established in the year 1972. A lot of vision by its founder members who thought we should come together to try to address problems which are specific to consultants. So from humble beginnings in 1972, currently we have reached a strength of almost 16,000 members. And I'm not sure how many consultant bodies in the country can boast of such strength. So we are definitely one of the organizations with a huge member strength, which is the crux of our organization. And because of this strength of numbers, we also form an important opinion making body so that we are called at various stages at the national as well as the Maharashtra level to give our opinions based on how policies should be framed, which are in better interest for all our members. And we are registered with the Charity Commissioner. So when we started with Mumbai, and slowly as AMC Mumbai developed, we realized that we have to spread our wings for the benefit of consultants in the other parts of the country as well. And currently, we are present in all these various locations that you see on the screen, and we are following the same footprints which AMC Mumbai had, and most of our members there are also as happy as they are with AMC Mumbai. So this various other organizations fall under the purview of what we describe as the Federation of AMC India, of which the current president is Dr. Niranjan Agarwal and the secretary is Dr. Nilesh Nafade. So what are the various activities AMC does? So we have different cells, as you again see on your particular screen, which takes care of different problems or different exposure with our members receive. So this affiliate cell looks after the various affiliate bodies which are apart from AMC Mumbai. Our health and accident cell looks after the mediclaim for these members. Our medico-legal cell, which is one of our flagships and flagship body, which looks after the medico-legal problems which all our members face, and also looks after the professional indemnity scheme. Then we have the CBS cell, which is the consultants benevolent scheme, which takes care of members' families after the member's death. Then we also look at the various nursing homes which are present in Mumbai and the MMR region, and try to be the voice of these nursing homes so that their issues can also be tackled. As far as individual member is concerned, we have a MMC interaction cell as well, so that we can form a bridge between the members and the Maharashtra Medical Council for all their various activities. As we are registered with the Charity Commissioner, social service has to be a part of our day-to-day activity, which is taken care of social service cell. And for the awareness and to spread the various activities that we do, we have the media and the communication cell. So the affiliate cell, the chairman is Dr. Kishore Adnyandan, the advisor is Dr. Lalit Kapoor. The health and accident scheme, like I mentioned for the Mediclaim, is currently chaired by Dr. Smita Sharma. So these are just some certain bullet points we have mentioned. I will not go into the details, but anybody who is a member of AMC and is interested in the health and accident policy, which is quite popular amongst members, they can get in touch with any of us to understand the nitty-gritties of that. The medico-legal cell again is chaired by Dr. Niranjan Agarwal and advised by the past chairman, Dr. Sudhir Nayak. The PI policy is one of our flagship policies, and I won't be overstating when I say that it is one of the best professional indemnity policies which is available to any consultant across India. There are a lot of salient features of our PI policy which sets us apart from other PI policies. Again, we and Rajiv and other of our AMC team members are welcome for you to understand why we should be going for it if you are a member of AMC. Again, the consultant benevolent scheme chaired by Dr. Shrikant Badwe, advised by Dr. Bipin Shah. Again, a scheme which makes sure that if any of our members unfortunately meets with untimely or death due to old age, within the next 24 to 48 hours, we make sure that a certain amount of sum is handed over to the family of our member so that the immediate financial troubles can be taken care of. The nursing homes body is chaired by Dr. Suresh Rao. The MMC interaction cell chaired by Dr. Sujata Rao, who is also our managing trustee. The social service cell chaired by Dr. Ajit Desai and advised by Dr. S.N. Agarwal. And the media and communication cell chaired by Dr. Mukesh Gupta. So with this, I'm leaving you with a few photographs of our annual flagship event, the one we just concluded also on 18th of Jan 2026, where we were graced by the presence of Shri Ravi Shankar ji. And with that, I would hand over to Rajiv to take this meeting forward.
Yeah. Thank you, Prashant. Let me also put it on record कि yes, definitely our medico-legal cell and the professional indemnity policy which AMC gives you is one of the best in India. And the best part is there is a backup team which helps you, to do that. There is my PPT one. Just open. And we help you right up to the Supreme Court. जो भी lawyer का पैसा रहता है, that is normally paid by the insurance company. तो वो लोग last में देते. But in our policy, the best part is the lawyer fees are paid by the association. So that is the reason why our policy stands out. ये तो just a minute. Yeah. So today we'll be talking about the small policy, which every one of us comes to know. That is the AMC umbrella policy, which we have launched exclusively on Doctor's Day for all our members. So the criteria is, if you want to take part in any of our schemes, you have to become a basic member of AMC. The life membership fee for an individual is 8,000 plus GST. That is 9,440, and for a couple is 12,000 plus GST. So once you become a member, then you can immediately take the policy for the professional indemnity. हमारी जो mediclaim की policy है for our members and their spouses and their family member, that is also unique because the claims are settled through Paramount but supervised and governed by us. तो अगर Paramount ने बोला कि भाई XYZ policy का हम इतना ही payment करेंगे, and if we say कि नहीं, you have to pay this much, then they will pay the entire amount. All this is through Oriental Insurance Company. So we again tied up with Oriental Insurance Company for this AMC umbrella policy for hospitals, exclusively for AMC members. I can be very proud to say that this policy has not been launched by any other association, and the premium which we have negotiated for our members is the best in its class, and no one can match it. So I am currently the president of AMC Mumbai till 29th of March. From my hands, Dr. Rajendra Nagarkatti will take over. I worked in various capacities in IMA, and I was fortunate enough to receive the Corona Veer Award also from Governor of Maharashtra during my Corona time for my exclusive work in Corona. Now, why in this health related thing we are discussing this umbrella policy? Because the health of the hospital is also important, and अगर आपके hospital का health भी आपने ध्यान रखा, then only you can be rest assured और रात को आप शांति से सो सकते हैं. So what is this value proposition? It's a proposition by AMC Mumbai. It's a consultant association with 16,000 plus member, and it is an NGO. So we are not here for profit. It is for the welfare of our member. And claim is a specialized service with the advantage of technology for us. So that is the reason why you get the best possible things with minimum, charges. And at the same time, कोई भी it is a foolproof policy. तो आपको कभी भी आप बेवकूफ नहीं बनोगे. कोई भी association से आप लोग है ना, so you will never be cheated. The best part is, yeah. So this is the master policy where AMC Mumbai will be the master policy holder. Any hospital, any diagnostic center, lab, nursing home, daycare center, even your clinic, they can become a member. They have to be a member of AMC, and then they can register for this. It's a business policy where all sections will be covered, which will be going through in the next few slides. It is voluntary for 12 months, but since it's a master policy, so it is on pro rata basis. अभी हमारा 11th July तक का नया रहेगा, and then after that again yearly it will be renewed. The premium comes to us, and from us it goes to the Oriental Insurance Company. You will get an individually policy certificate for your hospital name. जब भी claim आता है, तो claim will directly go to you. It will not come to us. And yes, we have signed a contract with Oriental Insurance Company for 3 years. So of course this policy will be renewed. Now, हमने इसको master policy क्यों बनाया? Individually, if Dr. Rajiv Agrawal takes a policy, it is quite possible कि मेरे hospital से अगर कोई claim आता है, so for the insurance company I'll be a liability. But if say 100 people come together and pay the premium, और उसमें से 10 लोग का भी claim आता है, तो still it is viable for the insurance company. Now, why we have chosen Oriental Insurance Company? First of all, it is a public sector unit. So it is not only just for profit, तो claim settlement अच्छा होता है. Secondly, we are already running 2 schemes through Oriental Insurance Company of our professional indemnity as well as a mediclaim policy for our member, where we are paying them almost to the tune of 18 crore rupees. So they will not cheat with us, at least, So this is the advantage. Now, what all things are covered in this policy? We have tried to cover about 17 to 18 sections. One section is missing here. I'll tell that also. So fire and allied perils. Now, what do you mean by fire? Everyone knows. Allied perils means any act of God. It could be lightning. It could be floods. It could be violence in hospitals. Even that is covered. So ये सब covered है. Earthquake is covered. A burglary including theft. A burglary is when there is a robbery in the hospital. What happened? Am I audible?
No,
Now
you were
you
not
are
audible for some time, Rajiv. Now you are audible.
Yeah. So, I don't know what went wrong. So, burglaries, theft within the hospital premises for the
Rajiv,
cash.
sorry to interrupt you. Your screen is not seen. Huh? You want to share it again?
Not seen. Okay. So यहाँ पे था इसके लिए. I don't know how it logged out somehow.
I think the network was the issue. It must have logged out.
Yeah. I'm not able to share my screen now. इसमें screen sharing दिखा. Yeah. Okay. Yeah. So burglary is चोरी अगर आपके हॉस्पिटल के प्रीमाइसेस में होता है तो दैट इज बर्गलरी. बिजनेस इंटरप्शन इज देयर इज इंटरप्शन टू योर बिजनेस रनिंग बिजनेस बिकॉज ऑफ दिस फायर और बिकॉज ऑफ वायलेंस और बिकॉज ऑफ एनी एक्ट ऑफ गॉड. 7 दिन से ज्यादा अगर आपका बिजनेस इंटरप्शन होता है देन this policy comes into effect. Machinery breakdown does not cover the normal wear and tear of the machinery. It covers any damage to the machinery because of say voltage fluctuation, accidentally machine गिर गया या कोई भी कारण से फ्लड्स की वजह से मशीन खराब हो गया, then that is covered. Similarly, it applies to electronic equipment including portable items. Now electronic equipments could be your sonography machine, could be your ECG machine and other thing. Portable equipments could be your laptops, computers, desktops, mobile phones. This a public liability. And what do you mean by public liability? It is liability arising when the patient is in the hospital to the patient or to the relative. So patient is on the bed, रेलिंग स्टाफ ने लगाना भूल गया, पेशेंट इज अनकॉन्शियस, गिर जाता है, हेड इंजरी हो जाता है, कोई फ्रैक्चर होता है, दैट इज पब्लिक लायबिलिटी. आपका हॉस्पिटल का फ्लोरिंग वेट है और पेशेंट के रिलेटिव्स या पेशेंट स्लिप होके गिर जाता है, दे मीट विद सम एक्सीडेंट एंड व्हिच नीड सम ट्रीटमेंट, सो दैट इज पब्लिक लायबिलिटी. मनी इंश्योरेंस इज इंश्योरेंस ऑफ योर मनी व्हेन द मनी इज बीइंग ट्रांसफर्ड फ्रॉम हॉस्पिटल टू द बैंक और फ्रॉम हॉस्पिटल टू योर हाउस. या आप घर पे से पैसा लेके आ रहे हॉस्पिटल में, उस टाइम पे आपके पास से चोरी हो जाता है, दैट इज मनी इंश्योरेंस. फिडेलिटी कवर इज एनी रॉन्ग डूइंग्स बाय योर स्टाफ. चोरी करते अगर आपका खुद का जो स्टाफ ऑन ड्यूटी है, जैसे कैशियर कैश काउंटर पे हमारा स्टाफ रहता है, इंस्टेड ऑफ टेकिंग द मनी इन हॉस्पिटल अकाउंट, ही टेक्स इट इन हिज अकाउंट. मतलब क्यूआर कोड आजकल चलता है, तो दैट इज फिडेलिटी. कैश ले रहा है, कैश पेशेंट ने दिया, उसने लिया लेकिन हॉस्पिटल में जमा नहीं किया, भाग गया. But the criteria is that staff should be on the payroll of the hospital officially. आप अगर बोलोगे कि नहीं कैश में, तो ऐसा नहीं चलेगा. Plate glass cover means all the glass in your hospital. This does not include the glasses used in the doors and windows. Neon sign. Today neon signs हमारे जो बाहर जो लगता है हमारे नाम का बोर्ड वगैरह, that has become very costly. More and more fancy things have come up, so we have tried to cover that. Directors and officers liability. This covers the liability of the director, partner, or whoever is the owner of the company. His statement may lead to some racist comment या फिर कोई किसी को feminist comment लगेगा. या उसने कोई भी statement in general about a political situation or any situation he gives, and that may lead to outrage, you know. So there, if there is any public liability arising out of that, that is covered. And workman compensation is compensation to your staff when they are in the hospital, when they are coming to the hospital, when they are going back from the hospital to the house. Whose time pe they meet with some accident or they meet with some permanent disability. So they will get, if there is a permanent disability, 1 lakh rupees compensation plus 1 lakh rupees towards cost of treatment if they meet up to 1 lakh. Now, it's a very simple thing. Soon on our app also, this portal will be live, maybe in another 45 days. We have already given it for upgradation. So you have to, meanwhile, whenever you want to take this policy, you have to call us up on AMC Mumbai, or you can mail it to us. We will send you an Excel format where you have to enter all the headings under which you want. Once that is done, it will go to prudent brokers who will calculate the premium and send it to you. Then, if you're okay with that, you pay the premium to AMC Mumbai, and from AMC Mumbai, we pay it immediately to Oriental Insurance Company. So it takes about 2 to 3 days. So if you don't have a policy, you should take it immediately. If you already have an existing policy, then you should wait for the time of renewal of your policy. So आपका policy suppose 15 मार्च का है, तो you approach us somewhere in around 10th or 15th of February, so that आपका कुछ pending भी रहेगा, कुछ queries रहेगा, तो it could be sorted out, and you know the policy is, तो आपका renewal हो जाएगा 15 मार्च से, even if you pay the premium earlier. So that is the best part. तो हम लोग क्या करते हैं, जब आपका ये पॉलिसी निकलाते हैं, तो we ensure that all your paperwork is done. That is the reason why you may take 7 to 15 days, you know, for complying with us, so that in future, when unfortunately if there is a claim, you don't land up into problems, क्योंकि आपको fixed asset register लेना पड़ता है, equipment के, machinery के bills, उनके format रहते हैं, उनके numbers रहते हैं, वो सब आपको pen down करना पड़ता है, so that in future, whenever there is a claim, you don't suffer. Prudent is our official broker, and we will tell something about Prudent also. और फिर Prudent और Oriental Insurance Company and AMC के थ्रू आपको प्रीमियम रिसिप्ट भी आ जाएगा और सर्टिफिकेट ऑफ इंश्योरेंस भी आ जाएगा. Now it's a master policy, as I already told, owned by AMC, and we have already signed the SOP with Prudent and Oriental. All hospitals who wish to come, they can enroll. Prudent is our official channel partner or broker. They are one of the biggest Indian brokers, and Oriental Insurance Company is the insurers who will take the risk, issue the policy, do the claim settlement, and review and give endorsement for everything. Now, why you should buy through the association? It is a thoughtfully curated policy. हमको मालूम है कि hospitals को doctors का क्या requirement है. Accordingly, we have made this tailor-made policy for our members, and we have tried to cover everything. It is very cost-effective, and the advantage of heavily negotiated premiums. I will show you in the next few slides the premium also. The claim assistance will be by Prudent as well as AMC. That is the best part. Ongoing support and review from us, and the risk management, we will tell you how you can, अगर आपका claim भी आता है तो आप उसको कैसे maximum claim कर सकते हो. अच्छा, one more advantage, we have already signed a MOU with Oriental where the surveyor has also been appointed. मतलब कोई भी आपके किसी का भी claim आएगा तो we have shortlisted 5 or 6 surveyors. उनमें से कोई एक Oriental Insurance Company appoint करेगा. These surveyors are big surveyors who cater to big industries, उनका कोई claim आता है. तो सबसे बेस्ट पार्ट क्या है, अपने हॉस्पिटल्स के क्लेम छोटे रहते हैं, तो देयर विल बी नो अंडर द टेबल मनी इन्वॉल्व फॉर योर क्लेम सेटलमेंट. वी ऑल नो कि अगर क्लेम आता है तो वो सर्वेयर आता है, बोलता है आपका इतना ही पास होएगा, आपको इतना पैसा देना पड़ेगा. तो दैट इज द रीजन व्हाई दीज सर्वेज हैव बीन अपॉइंटेड, सो दैट वी डोंट फेस दिस प्रॉब्लम. ये अच्छा बेस्ट पार्ट इज if there is a survey and you are not satisfied with the survey and you have reasons to justify that the survey report is wrong and they have intentionally or unintentionally given less survey, मतलब amount जो payable है, so you can write to us if you are convinced with your this कि भाई आप बराबर बोल रहे हो. A second surveyor will be appointed and they will do the survey free of cost. Second का भी आपको पैसा भरना नहीं है, और दोनों में से जो भी surveyor का maximum payable आएगा that we will give you. Now claim, it's a simple process, and Oriental Insurance Company, we all know it's very good in claim settlement, and Prudent brokers, Prudent broker themselves have 65 plus claim professionals. They are handling 1,75,000 claims annually, and their claims are worth almost 1,600 crores annual settlement they are doing with the insurance company. So, and there will be hand holding from AMC as well as Prudent in your claims, and we will keep on updating you about the about these policies, what innovations we are adding, something, or all those things will be there. So whenever there is a claim, you have to call us, and you have to inform us, yes, there is a claim in the hospital. Once you notify us, immediately a surveyor will be appointed, and that surveyor will call you up and he will visit your premises within the next 24 to 48 hours, and he will make a survey report at the earliest. He will give you a checklist and he will ask you to fulfill the requirements, जो भी bills वगैरह चाहिए उनको देंगे. And once all the survey report has been done and all your documents which needs are been submitted, then within 30 working days the claim will be settled. We have given a timeline कि पूरा पेपर सबमिट होने के बाद विदिन, वी ऑल नो ये जो क्लेम्स रहते हैं ये फायर वगैरह के, ये 6 महीने साल भर तक सेटल नहीं होते. तो 30 days इज द डेडलाइन आफ्टर यू हैव सबमिटेड ऑल द डॉक्यूमेंट्स. दिस इज द एस्केलेशन मैट्रिक्स ऑफ AMC and prudent brokers, where if you are not satisfied with the office staff, then you can write to our manager. If not, then the president secretary as well as the senior executives of prudent brokers. Now, commercial efficiency, most thing why we are talking here is, now you see, fire and allied perils, the premium by AMC is 0.15 per percentage. उसके बाद में एक zero लिखा है, so that is per thousand. That is in insurance terms.
Rajiv sir,
Yeah.
sorry to interrupt. The slides are not going ahead.
Not going.
They
नहीं दिख रहा
are not moving ahead. We are just seeing one slide since some time now.
है. मेरे
तूने
को तो
पावर
यहाँ पे
पॉइंट नहीं
move
किया उसको, पावर पॉइंट नहीं किया, पावर पॉइंट कर दे.
एक मिनट रुको, I will share it again. Is it visible now? Hello?
Yes, it is visible
Yes,
now.
it is
Visible
visible.
now.
अभी AMC के रेट दिख रहे हैं ना?
हाँ.
Yes.
Yeah.
Yes.
So fire and allied perils का the rate is 0.15 percentage के बाद में एक zero है up to 5 crore rupees. That is per mille. That is per thousand. And the retail rate, actual retail rate is 0.55 per mille. And the rate above 5 crore is 0.4 per mille. That is per thousand. Whereas the retail rate is 0.9 per mille. Terrorism का हमने इस पे include किया because nowadays with our so many neighbors, being hostile, so that is constant because IID does not permit it. So that is 0.13 per mille. Burglary including house breaking is 0.008 per mille. आपको मैं प्रीमियम भी बताऊंगा कितना आता है. And these right side पे जो retail rate है, that is the maximum retail rate by any of the insurance company. It may vary from insurance company to, अगर मैंने 1 लिखा है तो किसी का 0.5 हो सकता है, किसी का 1.2 भी हो सकता है. So it varies from insurance. Machinery breakdown is 0.16 per mille. मैं आपको प्रीमियम भी बताऊंगा नेक्स्ट 2 स्लाइड में कि कितना आता है. इलेक्ट्रॉनिक इक्विपमेंट इज 0.18. ऑल रिस्क पोर्टेबल इक्विपमेंट इज 0.09 per mille. Now this portable equipment includes your laptops, desktops, your mobile phones. आपको मालूम है कि मोबाइल फोन का कितना हम लोग इंश्योरेंस के लिए भरते हैं. I will show you in the next slide also. Money insurance is 0.04. Fidelity is 0.1. Neon is 0.1. Fixed class rate is 0.1. Public liability is 0.1. Directors and officer liability is 0.5 per mille. And workman compensation is 1600 per worker. तो आपके हॉस्पिटल में अगर 15 वर्कर है तो 1600 into 15 you have to pay. Effective premium is 42,630 rupees. And for a 10 crore policy it is 81,670. Whereas the same premium in a retail would have cost you anywhere between 2 lakhs to 4 lakh rupees plus GST of course. तो मैं आपको जो मैंने बोला I will prove it. Yeah. So now this is an illustration for a 5 crore policy. Is this slide visible? Is this slide visible for a 5 crore policy? Sample rater?
Yes, it is.
Yeah. So fire आपने देखा 15 पैसा per thousand है. So the premium comes to 7,500, whereas the retail rate would have been 27,500. Terrorist will remain the same. Can you mute yourself, whoever is talking in between? Yeah. Burglary and house breaking section. So I have kept this as a 5 crore policy. आज के तारीख में 5 करोड़ रुपए कैश किसी के पास भी घर में रहता नहीं है. अगर आपके घर में 5 करोड़ कैश है तो आपको बगलर से पहले इनकम टैक्स वालों से बचना चाहिए. तो हम जितने का लेना चाहे ले सकते हैं. ऐसा कुछ नहीं कि आपने ऊपर 5 करोड़ रुपए का किया है तो नीचे भी आपको लगता है कि आपके हॉस्पिटल में एट एनी गिवन टाइम 5 लाख रुपए रहता है, 10 लाख रुपए रहता है, तो अकॉर्डिंगली यू कैन टेक दिस. तो मैं आपको इसलिए 5 करोड़ का इलस्ट्रेशन बता रहा हूँ कि 5 करोड़ का प्रीमियम इज 40 rupees and the retail rate would have been anywhere around 50,000 rupees. Machinery breakdown for a 5 crore. आपके मशीनरी का जो भी वैल्यूएशन होगा, 1 करोड़ होगा, 50 लाख होगा, 2 करोड़ रुपए होगा, 2.5 करोड़ रुपए, अकॉर्डिंगली उसका प्रीमियम आएगा 8,000 रुपया. आज के तारीख में मशीनरी ब्रेकडाउन एंड इलेक्ट्रॉनिक इक्विपमेंट सेक्शन जो है ना, ये कोई भी इंश्योरेंस कंपनी देना नहीं चाहता बिकॉज इसमें बहुत सबसे ज्यादा क्लेम्स है। इसके अंदर एक राइडर है कि जो भी मशीन या इलेक्ट्रॉनिक इक्विपमेंट आप यूज करोगे, पोर्टेबल इक्विपमेंट, इट शुड नॉट कॉस्ट मोर देन 25 लाख रुपीज। सो मोस्ट ऑफ द सोनोग्राफी मशीन विल बी कवर्ड, बट योर सीटी स्कैन, एमआरआई या हाई एंड मशीन विल नॉट बी कवर्ड, एंड द मशीन हैज टू बी लेस देन 10 years ऑफ एज। मतलब 10 साल से ज्यादा अगर पुराना कोई भी मशीन, इक्विपमेंट या फर्नीचर रहेगा तो दे विल नॉट बी इंश्योर्ड। मतलब आप इंश्योरेंस निकालोगे भी तो उसका कुछ डैमेज हुआ तो आपको पैसा नहीं मिलेगा। नाउ यू सी लैपटॉप, टैबलेट्स एंड मोबाइल फोन, 5 करोड़ के पॉलिसी का आ रहा है 4,500 रुपया। हमारा आप देखिए, आपका अगर इतना कोई वैल्यू होता नहीं कभी भी, आप समझो 10 लाख रुपए का होएगा अगर आपने मोबाइल फोन है, लैपटॉप है, आपके पास सर्वर, या 5 लाख का होगा। तो अगर 5 करोड़ का 4,500 रुपया है, तो अगर आपने 5 लाख का लिया तो इट विल कम टू 45 रुपीज, तो आप देखो कि आज के तारीख में हम एक मोबाइल फोन एप्पल का 17 प्रो मैक्स जब हम इंश्योर करते हैं, विच कॉस्ट अराउंड 1.7 लाख रुपीज, तो उसका प्रीमियम कम्स टू अराउंड 17,500, वी आर ऑफरिंग यू इन 45 रुपीज। So this is what association is offering. Money insurance is again for 1 crore, it is 40 rupees. आपको ये सब के सब साथ में लेना कंपलसरी नहीं है। फायर इज कंपलसरी, मतलब फायर तो आपको लेना ही लेना है। उसके अलावा ये जो बाकी के जितने भी बचे हैं ना, उसमें से यू कैन चूज मिनिमम 5 एंड मैक्सिमम ऑल। मतलब आपको टोटल 5 लेना है, उसमें 1 तो फायर है, बाकी के इतने जो भी 12-13 सेक्शन है उसमें से कोई भी 4 आप ले सकते हो। आप सब लेना चाहे सब भी ले सकते हो। तो अगर आपको फायर के साथ में कुछ दूसरा लेना है, तो आप ये जैसे बगलरी है, ये 5 करोड़ के बदले आप 5 लाख का ले लीजिए, तो आपको हार्डली 40 पैसे का प्रीमियम आएगा। हाँ, फिर आपका मनी इंश्योरेंस है, या आपने 1 करोड़ के बदले आप 10 लाख का ले लीजिए तो आपको 4 रुपए आएगा। हाँ, फेडिलिटी इंश्योरेंस 1 करोड़ का है, आप इसको 10 लाख रुपए का ले सकते तो ये 10 रुपए आ जाएगा। नियॉन साइन ये मैंने 10 लाख का डाला है, इसको आप 5 लाख ले सकते हैं, 2 लाख ले सकते हैं, अकॉर्डिंगली आपका नियॉन साइन कितने का है। फिक्स ग्लास प्लेट हॉस्पिटल में ग्लासेस जो है, ये मैंने 25 लाख रुपए का लिखा है, लेकिन मुझे नहीं लगता 3-4 लाख 5 लाख से ज्यादा हॉस्पिटल में ग्लासेस रहते हैं आजकल। तो उसका आपका प्रीमियम देख लीजिए। सो अकॉर्डिंगली ना योर प्रीमियम। नाउ वी हैव इंक्लूडेड साइबर इंश्योरेंस ऑल्सो, एंड दैट इज ऑल्सो 0.4 पर मिले। तो आपने 5 लाख रुपए का अगर साइबर इंश्योरेंस लिया तो प्रीमियम विल बी 2,000 रुपीज। तो इफेक्टिवली जो मैंने बोला 42,630 विल बी द प्रीमियम, and with GST it is 50,303, whereas the same retail policy from various insurance companies would cost you around 280, and with GST it would cost around 330 rupees. Now this is the illustration for a 10 crore policy. Here again same things, आपको जितना लेना है उतना ले सकते हैं। आपको 10 लाख, 5 लाख, 50 लाख, ये जो बाकी के नीचे के सेक्शंस है, as per your valuations you have to take this, and the premium would be 81,670, with GST it is 96,000, whereas the retail would have cost you 4 lakh plus GST. Now, cyber as a insurance we have specifically included because more and more cyber crimes have been conducted nowadays, and it's a specialized policy designed to protect your establishment from financial losses resulting from cyber attacks and data breaches. It covers data recovery costs, legal fees and public relation expenses, business interruptions and loss of income, as well as regulatory fines and penalties. तो आपके लॉयर का भी पैसा मिल जाता है, प्लस आपको कोई पेनल्टी गवर्नमेंट लगाती है, दैट इज ऑल्सो कवर्ड, बट दैट विल बी अप टू 5 लाख रुपीज। आपने अगर 25 लाख का लिया तो अप टू 25 लाख रुपीज, द प्रीमियम विल वेरी अकॉर्डिंगली। मोस्ट फ्यू इंपॉर्टेंट थिंग्स टेक ओवर मैसेज, यू हैव टू हैव अ फिक्स एसेट रजिस्ट्री, आपके पास कितने क्या है। जितना आप डिटेल में बाइफर्केशन दोगे उतना आपको फ्यूचर में कभी भी क्लेम सेटलमेंट आएगा तो दैट विल बी बेटर। फ्यू टेक होम मैसेजेस व्हिच ऑल ऑफ यू शुड नो, whenever you are insuring your property for fire, it should not be the MRP of that property. मतलब MRP मतलब I have a 10,000 square foot hospital in Mira Bhainder. Now the construction cost is say 5,000 rupees square foot and the interior is say 1,000 rupees, so 6,000. तो मेरा प्रॉपर्टी का वैल्यू 6 करोड़ होना चाहिए, बट मार्केट प्राइस यहाँ का हो सकता है 25,000 रुपए हो, तो उसका प्रॉपर्टी का वैल्यू कितना हो गया 25 करोड़ रुपया, प्लस समझो मैं फर्नीचर का वैल्यू 1 करोड़, तो 26 करोड़। So I don't have to insure myself for 26 crore. I have to insure my hospital for 6 crore. It is the cost of building back the same premises back to its original form. वो पैसा आपको इंश्योरेंस कंपनी देगा। तो आपने अगर प्रॉपर्टी का इंश्योरेंस 26 करोड़ रुपए दिया है और आपका प्रॉपर्टी को टोटल डैमेज हो गया, बिल्डिंग कोलैप्स हो गया बिकॉज ऑफ अर्थक्वेक, तो आपको 26 करोड़ नहीं मिलने वाला है, आपको सिर्फ 6 करोड़ मिलेगा, बिकॉज दैट इज द कॉस्ट ऑफ कंस्ट्रक्टिंग बैक योर प्रीमाइसेस। तो आपको लग रहा है कि भाई कंस्ट्रक्शन कॉस्ट 5,000 है, 6,000 है, 7,000, उसके हिसाब से आप लीजिए, आपका फर्नीचर का कॉस्ट है उसके हिसाब से आप बिल्डिंग का वैल्यू निकालिए। Whenever you are insuring your equipments, you should insure them as per the MRP, That is the retail price today in which you will get the machinery, not at the depreciated price. So suppose I have a sonography machine worth 20 lakh rupees which I purchased in 2020. अब वो depreciation करके आज उसका value suppose 8 लाख रुपया है. So I should not insure myself for 8 lakh rupees. I should insure myself for 20 lakh. कि अगर वो मशीनरी को टोटल डैमेज हो जाता है तो जो भी मिनिमम डिडक्टेबल्स माइनस करने के बाद आई विल बी गेटिंग 20 लाख रुपीज. अगर कोई मशीनरी में क्लेम आता है तो उसके अंदर अगर समझो क्लेम समझो 2 लाख रुपए का आया और आपने अगर डेप्रिशिएटेड वैल्यू 8 लाख रुपए का इंश्योरेंस निकाला है तो आपको 40% ही आपने इंश्योरेंस निकाला है तो आपके 2 लाख के क्लेम में मिनिमम डिडक्टेबल माइनस करने के बाद आपको उसका 40% ही मिलेगा. और अगर आपने पूरा 20 लाख रुपए का निकाला है तो आपको 2 लाख के अंदर जो मिनिमम डिडक्टेबल है 1000-2000 रुपए वो माइनस होने का बाकी का पूरा अमाउंट. एंड इफ देयर इज अ टोटल डैमेज आपको पूरा 20 लाख मिलेगा. तो ऑलवेज रिमेंबर in property insurance it is the cost of reinstating the policy back to its original form, whereas in this medical equipments या mobile phones या laptop desktop इसके अंदर not the depreciated value, it is the actual price of the value. You should know the make, mobile, model, serial number वगैरह सब आपके पास documented होना चाहिए and save it on your drive, you know, so that in case of fire अगर paperwork destroy हो जाता है सबको scan करके आप drive पे load कर दोगे so it will be easy. This is everything is written now. Currently we are partnering with Oriental Insurance Company and Prudent. This is just our small advertisement. This is the platform, tech platform, which you will be enabled, you know, very soon for all the policy takers. Something about Prudent, they are the key brokers for property, liability, marine, the number 1 broker for general aviation and trade, largest flexible benefit and trade credit program in India. They have received Broker of the Year for 21-22. Handling more than 1,75,000 claims, 65 plus claim professionals, and 11 lawyers on board, you know, having offices in more than, you know, 12 cities in India, 4,500 corporate clients, insuring about 6.74 million lives, 1,500 plus employee base, and placing 6,000 crore plus annual premium. Or these are some of the healthcare sector to whom they corporates whom they cater. तो आपको दिखेगा मैक्स हेल्थ केयर है, एस्ट्रा डीएमएस, फिलोमिना है, सीके बिरला ग्रुप है, बत्रा है, संजीवनी एंड अदर्स. So that's all from my side. I am open to 1 or 2 questions, or you can put the question in the chat box. I'll be happy to answer it. Thank you. This is my number. You can contact me anytime if you have any queries. So over to you, madam. I don't know who's.
Yes, thank you, sir. Thank you for the collaboration. A very good afternoon to everyone who is joining here. I am Dr. Anuja Pethe. I am one of the directors on the board in the Mumbai chapter PAN. So let me just quickly tell you about what PAN is. But before that, I want to thank AMC, Dr. Rajiv sir and Dr. Prashant and the entire core team of AMC for this collaboration. We had a wonderful program on 14th December where we touched upon the basics of evidence-based nutrition and how doctors can start implementing it in their own lives as well as in their patients. So nutrition as a core aspect of their prescription. And after the success of that program, AMC was gracious enough to invite us again for this collaboration. So heartfelt thank you to both of you, sirs.
Yeah.
I would like
Thank
to
you, madam.
share.
Sorry, I forgot to mention about PAN because वो मैंने directly lecture पे चला गया इसके लिए. So we are as AMC also, myself and Prashant are really thankful to PAN, and really the web online this physical conference which we had at IMAJU in association with PAN was an eye opener, and I realized कि हम लोग बहुत सारे चीजों में इतने हमारे misconceptions है, हमारे misbeliefs है कि we are doing many things wrong things, you know, in spite of being correct, you know. And that is the reason why we have started this series. At least 2 will be there. One is this month and one will be next month. We will soon allow the dates for that also. So thank you, PAN, Dr. Rupa Shah, and all the speakers from AMC. Over to you, madam. Sorry.
Yeah, so I will just share my screen. So just tell me whether my screen is visible.
Yeah, it is.
Yes.
It is visible.
Thank you. So we are Physicians Association for Nutrition. and that is PAN for short, and we are Pan India. And we are part of a global NGO network of Pan International, which operates from 10 countries and is headquartered in Germany. We are a non-profit organization, and the main focus of work is to promote evidence-based nutrition knowledge among the medical personnels, and then spill over to health benefits in the patients, and also help sustainable eating patterns and promote planetary health as well, because all of this is interconnected. The mission is to empower India's healthcare professionals with evidence-based nutrition, enabling them to prevent and manage chronic diseases. So we aim to train 10% of the medical fraternity in the next decade. And we want to advance nutrition-specific research as well as integrate nutrition science in medical education as well. So this is the locations where Pan India Global Network is located. In India, we have 3 focus areas. One is to train medical doctors to integrate evidence-based nutrition in their practice. Another is to have rigorous research so that we have our India-specific research when it comes to nutrition. And third is to build a strong ecosystem around nutrition where we impact public awareness. We are part of policy advisory. We also guide industry, and we also form partnerships and collaborations to promote the cause of healthy nutrition in patient care. So PAN governance has a general advisory panel and a medical advisory panel with collaboration among these two. This is the Pan India Governance Board, where we have Ms. Rinki Singh as Executive Director and Dr. Rajina Shaheen as the Medical Director. Then we have this Medical Program Strategy Team. We have the Scientific and Medical Advisory Council, where we have Dr. Hemlata, who is the ex-director of ICMR NIN, and also prominent cardiologists, internal medicine doctors, endocrinologists, and surgeons among the advisory council. We have Pan India core teams, which are the medical team and the program management team. And these are some of the accomplishments. These are till year 25, but in the year beyond year 25 till year 26, we have conducted more than 50 in-person CMEs, the last one being at Bangalore with more than 600 doctors in attendance. We have more than 60 online sessions in the form of webinars and discussion forums and journal clubs. We have created a strong network of healthcare professionals of more than 16,000 doctors all over India. We have 3 well-established chapters, and we are also undertaking multiple clinical and research studies in the field of nutrition. These are the locations where we have conducted in-person CMEs. One of it was in IMA Mumbai West on 14th December with AMC. So these are the online programs. We have regular webinars. We have regular journal clubs where we discuss relevant data research, and also discussion forums where various topics related to evidence-based nutrition are discussed. That's the Pan India team. We have 3 strong city chapters, Bengaluru, Mumbai, and Hyderabad. Our Mumbai chapter is headed by our chairperson, Dr. Rupa Shah, and we are a board of directors as well as the advisory panel. This is the Bengaluru chapter and the Hyderabad chapter, and there are some chapters in the pipeline, especially in Delhi and other areas. So when it comes to research and collaboration, PAN wants to collaborate with the industry, collaborate with other organizations, so that together we can have a strong impact in the field of nutrition when it comes to prescribing nutrition as well as forming nutrition-related policies. So to contact us, you can connect with the telephone number on the screen, or email, or connect with the website pan-india.in. You can also check out the PAN International website, and we also have an application for the PAN community, which is called PANCO, PANCO. You can check that out on the PAN International website as well. So with that, I would finish the introduction of what we are. And now I would introduce our next speaker, Dr. Smriti Naswa. Dr. Smriti Naswa is a dermatologist primarily. She is also done pediatric dermatology, and she has also done her diploma, International Board of Lifestyle Medicine diploma. And she is a practicing lifestyle medicine physician as well as a dermatologist at Fortis Hospital. She is passionate about implementing lifestyle medicine principles, including nutrition, in her practice, and has found remarkable improvement in all her patients when she applies these principles along with the conventional dermatology treatment. Over to you, Dr. Smriti. I would stop screen share now.
Thank you, Dr. Anuja Pete. Thank you, AMC. A very happy afternoon to all of you. As Dr. Rajiv and Dr. Anuja has mentioned, we had an offline CME and now we are going ahead with online CME. It will be a series. So the first one is basically to context setting series, this one, where we will be incorporating everything about the lifestyle medicine and evidence-based nutrition. It's important for the newcomers especially. And we will go deeper as the next series continues in coming months. Without further ado, I will start my talk. Just a second. Right. So if you can let me know, is my screen visible? Someone can let me know if my
Yes.
screen is visible.
Yes, it is. It is.
Sure. So okay. And there is no problem with the other things, right? So yeah, sure. 6 steps for a healthy lifestyle. So all of us are modern medicine doctors, and we have been taught a specific way of treating with an SOP. You find the disease and you find the solution. But we have been seeing since 2000 here, the communicable diseases, which were very easily to treat, the infections, they come from some infective agent from outside. We give antibiotics, antivirals, antifungals, and then they go. But non-communicable diseases slowly are taking the chunk of the diseases globally. And India is not far away. It is becoming the diabetic capital of the world. The problem is that earlier we used to think that the non-communicable diseases only affect the older generations, but now we are seeing it in children, adolescents, and youth as well. A lot of chunk of expenditure that goes for the states of India goes with regards to diabetes, cardiovascular diseases, and cancer. They are all topping the charts. And this expenditure is creating problems. The Indians have a very, very peculiar condition. Now, these chronic diseases, they do not have vaccines, they don't have antibiotics to treat them, they are very, very chronic. And for us Indians, as our genetics, we get diabetes at an earlier age, at lower BMI. Similar is that we are more predisposed to CAD and alcohol dependence. So our genetics really makes us very, very prone to the lifestyle diseases. So the question arises, are we doomed? Well, the answer comes with the concept of the interplay of genetics and epigenetics. Earlier, we used to feel that the epigenetics are the junk genes, but now we have realized that all of the environmental aspects, whether the internal environment or the external environment, our AQI, pollution, the stress, the toxicants, when they have an impact on the epigenes, only then the phenotypic changes happen in the genetics, and then the diseases manifest. So, to sum this beautiful concept, Dr. Caldwell Esselstyn has said that genetics load the gun, lifestyle pulls the trigger. Hence, the concept of healthy lifestyle. There was a beautiful study done in around 1900s when the death of US were found, and they found that 40% of those deaths were due to the behavioral choices of tobacco, poor diet, physical inactivity, and alcohol consumption. More importantly, now the poor diet and physical inactivity has taken #1 stage over and above the tobacco. So out of the 50% of the deaths that happened because of the behavioral, 40% were modifiable. They were preventable. And with this concept, the concept of lifestyle medicine came in picture. So what lifestyle medicine is that? It uses the therapeutic lifestyle interventions as the primary modality to treat the chronic condition. And we see a whole person prescriptive lifestyle change as the primary modality with the support of the medicines. So we work on the root causes, which is the lifestyle choices. So is the lifestyle medicine different from the conventional medicine? The answer is no. Actually, it is the foundation of conventional medicine. If we go back to our MBBS books, everywhere they'll always say, the first line is diet and exercise. So why should we all doctors across specialties, medicine and surgical, start incorporating the evidence-based nutrition and lifestyle medicine prescription in each one of our patients and give them a better quality of life, whether they are at a stage of primary, secondary, or tertiary prevention? So these are the pillars of lifestyle medicines, which are our 6 steps to a healthy lifestyle: nutrition, exercise, sleep, stress, substance abuse avoidance, and healthy relationships. So this was a hypothesis based on a very robust data, but we as modern medicine practitioners have to prove it. The landmark study was done by Dr. Dean Ornish, and I would request all of you to read this book by Reversing Heart Diseases by Dr. Dean Ornish. He had a trial on 1990. The details will be discussed in the next talk by Dr. Anuja, but I'll just tell you the gist. These were 2 types. They had a randomized controlled trial, and they divided the group into 2 groups. All of them were not planned for CABG, but they had 1, 2, or 3 vessel diseases, and they were not on lipid-lowering agents. The first one were given the standard care as per AHA. The second one were given 10% low-fat whole food, vegetarian diet, aerobic exercise, stress management, smoking cessation, and group psychosocial support. In the standard care, over 1 to 5 years, they saw that the stenosis of the arteries was worsening up to 27.7%, while there was remarkable difference. Not only at year 1, but continuing at year 5, the stenosis was actually decreasing in the intensive lifestyle prescriptive changes, which was 7.9% improvement. This is the photo by Dr. Caldwell Esselstyn on how plant-based nutrition was decreasing the plaque size. And it was not all. That was not one random study, but the multiple studies, robust methodology, long-term follow-ups up to 30, 40, 50 years with participation as big as 1 lakh participation. And a lot of them are still continuing, not only abroad in India. Also, they have all proven that these 6 pillars of lifestyle, they really help in these diseases. And these are the doctors who started in 70s and 80s in the Western world. And one thing that was really common about all these doctors, Dr. Neil Barnard, Drew Goldner, and T. Colin Campbell, they all did these changes for their own selves first. And when they found it, they did it, and they worked on the RCTs. And it's not stopping here. Now, American College of Lifestyle Medicine and lots of Indian universities, CMC Vellore, AIIMS Nagpur, Tufts, in agreement of Indian Institute of Science, have come up with diplomas and PG certification courses for lifestyle medicine. So if I talk about us physicians, I'm not even talking about our patients. 20% of us are obese in India. 50% of us are diabetic and 24% are hypertensive. So we all are also having these diseases. As a matter of fact, a CDC study said that the physician burnout is quite high when it comes there. A healthcare practitioner, in chronic cases, they really feel the burnout. So how these 6 pillars of lifestyle medicine can help us as well as our patient. In the doctor's health, it can help in 2 ways. Number 1, the surgeons who regularly exercise are less likely to feel burnout, who talk to families, spend time with them, they are also less likely, and who have proper circadian rhythm, they sleep on time, they also have lesser burnout. Secondly, those doctors who prescribe the lifestyle medicine prescription to their patients, 90% have reported their professional satisfaction is higher. There is a sense of accomplishment and meaningfulness. And when you have that, you really feel like going to your OPDs every single morning, even with those chronic patients, because you have something for them, and that is hope. So doctors are the role models for their patients. So we have to practice what we preach. There was a study to prove it, that those doctors who exercise, they're more likely to counsel the patients who exercise. Those who are non-smokers will likely to counsel about smoking as well. Those who eat less fat are more likely to counsel about cholesterol. Those doctors who themselves are eating lots of fruits and vegetables will be really delving in the details of the nutrition of that. So our habits really inspires our patients to improve. This is Dr. Davis Sabgir, a cardiologist from Ohio. He was like, I really want you to walk for your health, for your heart health. So what he started was a walk with the doc OPD. So he started walking with his patients, and his OPDs were walking with them, and the whole of the community got inspired. And this is how we can inspire our patients with when we have good nutrition, social support, we exercise regularly, it comes out in the way that we counsel our patients and we help them. So with that note and very important aspect about lifestyle medicine, let me quickly go through all of the pillars of the lifestyle medicine, starting with nutrition. This is an important Lancet study of 2017, which talks about global deaths attributable to the individual dietary risks. See, so all of us all talk about stop your red meat, and then because it is a type 1 carcinogen, but it is very low in coming to the causes of the dietary risks. Then we talk about ultra processed foods that, high trans fat, less calcium, high sugary drinks, they are causing the diseases of today, but they are missing the bigger picture. The bigger picture is that the less whole grains, less nuts and seeds, fruits, vegetables, less fiber, pufa and legumes, 7 out of 9 in the highest in the hierarchy of these dietary attributable risks are lack of whole food, plant-based diet. Now, what are we eating today? This is our plate. Typically, in all of the meetings, conferences, we see this. But what is missing? We all test our patients and ourselves for vitamin D, vitamin B12. But you know what? 90% of us throughout the world are deficient in fiber. And that is what is lacking in today's diet. And why is fiber important? Fiber is important because fiber is prebiotic. It is the food for our gut bacteria. And the gut bacterial lining is the most important barrier to all of the insults that we get through the environment, external or internal. When the fiber is not there, we get the leaky gut, and then all of these small chemicals leach into the blood vessels, and there they create inflammation, autoinflammatory syndromes, autoimmunity, hormonal diseases, allergies, cancers, and everything. So what are the foods which do not have fiber? The fiber is absent in meat and chicken, fish and eggs, milk and milk products, and the processed and packaged ultra-refined plant foods. And though the fiber is present in, we call it a resha. It is in the greens, the vegetables, the fruits, the legumes, the sprouts, seeds, nuts, and whole grains. If I will simply try to tell you what exactly is a whole plant food, that is how your plate should look like. So then the left, we have a grain with a bran, that is the whole food. And on the right side, we have the grain without the bran. So that's the difference. So no, not all the carbs are equal. On the left side, we have simple carbs, which are refined ones. These are processed foods. On the right side, we have complex carbs, which are the whole foods with fiber and the nutrients and phytonutrients. On the left, we have processed plant sources, the protein sources. On the right, we have whole protein sources of nuts, seeds, legumes, beans. On the left, we have processed oils, which can increase our fat and cholesterol levels. On the right, we have the nuts and seeds, which actually compete with the body cholesterol and do not let it increase in plaque formation. We should read about the Jetkins portfolio diet, where this actually decreases to the tune of statins. American College of Lifestyle Medicine actually, for this reason, asks us to have 50% of our diet as fruits and vegetables, the beverage of choice being water, 25% whole grains, and 25% plant proteins. But is that so? No, it is being continued. The same thing is being told by the governments. The government of India, ICMR 2024 plate also has 50% of the diet as the fruits and the vegetables, 25% grains, a handful of nuts and seeds, and 25% plant proteins. The Canada has the same plate, 50% fruits, vegetables, 25-25. Even the United Kingdom, see the bigger chart. The bigger chart is the fruits, vegetables, and the whole grains. So then the people say, oh my God, if I eat all the fruits and vegetables, I'll really become weak. This is the story of a lady. This lady had come to me with urticaria last 4 years, trying everything, thyroid also there, and she will not improve without steroids. At one point of time, we did not want that because she was shifting from a non-diabetic to pre-diabetic. We shifted her diet to whole food, plant-based, and in few months, the urticaria settled. And you know what? After that, she went on to become the second runner in the 10-kilometer run in the post 50 age group. And she even went to the Everest base camp. So that does not make you weak. And majority of us also say, okay, fine, but I love my chole bhature and I will run and I will do that. You'll have to remember one very important point. You cannot outrun a bad diet. The 1300 calories of 20-minute eating, you'll take half a marathon to burn it. How many of us do half a marathon daily? So what is very, very important about this plants in a whole plant-based diet is that we really do not have to count our calories. It's very simply because this much of oil, this much of banana chips is the same as this much of calories. But when we eat fruits and vegetables as our first meal, our stomach gets full. We feel lean. We feel satisfied. We have no extra hunger pangs. And that's because of this simple picture that you should remember. 4 tablespoons of olive oil is same as this much of whole plants. And that's what is a 480 calories. And this is another thing, very, very Indianized version. You always say, ma'am, मैंने कुछ नहीं किया, मैंने तो सिर्फ थोड़ी सी चाय कॉफी और 4 बिस्किट्स खाए थे. दिस इज द अमाउंट ऑफ कैलोरीज आर वी आर टॉकिंग अबाउट. एंड 2 वड़ा पाव तो हम बस साइड में स्नैक की तरह खा लेते हैं, विच इज इक्वल टू 3 मेथी का थेपलास, 1 चीलास एंड 1 नट्स एंड सीड्स का और पीनट का चाट. That much of empty calorie we are taking with no nutrition for that matter. But अगर हमारा दिल जो है उसके ऊपर हमारी टंग आती है तो हमारा टंग तो मानता नहीं है. So all these foods can be had in very, very tasty manners. These are all my plates. I always tell my patients also, don't cheat. Always celebrate. You'll just have to change to healthier ingredients. Instead of maida, you can have jawar-based or rice-based or almond flour-based cakes. And we have beautiful bakers creating ice creams. We have fruit smoothies. We have sattu peanut laddus and ragi pancakes looking like chocolate pancakes. So current Indian plate, if you see this, they say, मैं तो घर का खाना खाता हूँ. फिर डायबिटीज क्यों नहीं ठीक हो रहा? क्योंकि आपकी पूरी की पूरी प्लेट प्रोसेस्ड आपके वो वाइट चावल से और वो पतली रोटी से है और आपका दाल सिर्फ पानी जैसा दिख रहा है. यू हैव टू शिफ्ट टू 50% ऑफ द डाइट एज द फ्रूट्स एंड वेजिटेबल्स, 25% गाढ़ी दाल एंड 25% दिस इज मिलेट राइस. And it's not only true for us, it's also true for the top athletes, whether it is Serena Williams, Sunil Chhetri, Virat Kohli, Novak Djokovic, all of them are shifting to more of plants. It's only because they have very quick recovery. And more than that, they are fighting, competing with younger people. Novak went to finals and he was 40 and he's competing with 22 years old Alcaraz, and Sinner he actually defeated in the semi-finals. So the second thing very important is exercise. It's very, 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 very alarming that 78% of us, 3 out of 4 of us are not exercising even enough. We only walk. We don't walk. Actually, we only stroll, and strength training we don't do. Unfortunately, the adolescents are lagging much behind than us. And this is a man who had hidradenitis suppurativa, an autoimmune and hormonal condition. We also call it inverse acne. The answer for it is adalimumab, the biologicals, that it is there to be taken monthly and every fortnightly initially and then monthly till 50 or 60 years of age. He said, no, I do not want to do that. I said, okay, let's work on your diet and lifestyle. He worked on it. He shifted from this to this. And I've been meeting him for last 2 years. His lesions are gone, largely gone. If at all he had an extreme stress, his father expired when he actually got 1 or 2 lesions and they improved with 7 days of antibiotics. Imagine the amount of difference an exercise can bring to you. The third pillar is sleep. What is very, very important to understand is that मैं तो 8 घंटे सोता हूं does not work. People are sleeping at 2, at 1, at 12. The idea to remember is circadian rhythm. Melatonin rises at 9 p.m. and dips at 4 a.m. From 10 to 4, our body rests and repair with parasympathetic nervous system. After 7 a.m., steroid peaks up and our body is ready for sympathetic fight, flight, fright response. When we sleep delayed post midnight, steroid secretes at night, and that causes premature graying, the thyroid function not being well, we are not able to lose weight. Even they say when we have dinners before 7 p.m., it's now proven beyond doubt by studies that it's heart protective. More than that, those who really want to build their muscles, remember, one day of sleep deprivation can cause so much of muscle loss, and one night of sleep deprivation can cause so much of fat gain. And that's why Yoshinori Oshumi got this Nobel Prize for intermittent fasting. When we shift to 16 to 18 hours, it is insulin sensitivity sets in. And when we shift to 24 hours, then autophagy sets in. The very important aspect about autoimmune diseases and cancers, autophagy has been proven by studies on pediatric cancer patients as well. Very important pillars in today's date is mental, emotional, and spiritual health. This is a concept called as Shinrin Yoku by it was done by Dr. King Lee of Japan. And what he found out that, you walk in your basement, you walk in your compartment, you walk indoors, you walk on the treadmill, it has an impact on you. But we walk in the forests, the phytoncides released by the trees, they have calming thing. So he brought those beautiful, he brought those phytoncide chemicals and they put in the ICUs, and the nurses in the ICUs said, initially they were saying, I only 13% chance that I can handle a difficult situation. It shifted to 58% saying that, yes, bring a difficult patient. I can handle it without a burnout. So when on the weekends, don't go to malls. Go to the farms, go to the forests. You will save the nature as well. More importantly, good food leads to good mood, because 90% of the neurotransmitters and all of the serotonin is liberated in gut. So when we are giving the food with fiber for the gut bacteria, the serotonin itself liberates. That's why a chocolate or a caffeine will give us bumps, short duration, but fruits, vegetables, these beautiful colors of rainbow diet will make us happy. And we will be calmer in difficult situations. This is a lady who had oral pemphigus, and she came to me saying that for last many years, 5-6 years, only rituximab works on her, steroids don't. So I said fine, and she was desperate. We checked her for IGRA, and she came out to be latent TB positive, and I could not give her rituximab, and all the option that we had was steroid. None before this steroid could ever work on her, and she would become desperate. So I started taking her lifestyle medicine history, and I found out that this time, after 2 or 3 years gap, her sudden exacerbation of oral pemphigus and autoimmune diseases came when her son got unwell, got diagnosed with autism, and he was having lots of difficulties with him, and she was really getting flustered as an emotional mother. So I started working on her stress quotient. Besides that, I worked on her diet. And as I told you, the whole food plant-based diet, emotionally also, it supports her with the serotonin. You won't believe, for the first time in her life, the same steroids started working on her. I could stop her from the steroids in 3 to 4 months, and she was healed. Not only was she healed, she keeps coming back to me every since last 3 years, and she's been doing very, very well with not needing oral steroids now, because she's maintaining her diet. So skin is the mirror of internal body and mind, and it's always mind over body. We all have talked about this a lot of times, that we should not go for drug abuse. But the biggest problem of addiction today is digital addiction. And the problem happens, we have to be very, very vigilant with our adolescents and the youth. If they are having a problematic social media use, there's 44% more likely with depression. That's that clinginess, the delusional clinginess to the digital. And especially if they're having nighttime specific use, the study says that it is likely to have low self-esteem, anxieties, and poor sleep issues. The second addiction, which Dr. Varsha in her third talk will talk in details, is that of the whites and the refines and the ultra processed foods. And you have to understand it's not a young generation phenomenon. Here, 50 to 80 years of age group is showing 44% of them, almost half of them are addicted to the whites and the refines. And that's the problem with the additives. You just cannot eat just one because they have a brain reward system. Not only that, they are endocrine disruptors and they have the problems of headaches and neurological complications as well. Coming to the last pillar, which is the healthy relationships of social connectedness and positive psychology. The meaning that we give to our life is through the real social connections. And what better than the Blue Zones diet that tells us? You can go through this book. It's a beautiful book where they found out 5 places: Okinawa, Japan; Icaria, Greece; Sardinia, Italy. And they found why the people there are, not only octogenarians, they are centenarians. That's because they have purpose. They move naturally. They eat mindfully. They have a plant slant and they have a feeling of belongingness. In the evenings, they will be there dancing together, working on their natural gardens and all. And one beautiful thing about them, 95% to 100% plant-based diet with the meats coming very, very occasionally, and they eat out of their kitchen gardens. And that's the beauty of their life. It's the same principle as told in Bhagavad Gita as well. Yuktahara viharasya yukta cheshtasya karmasu yukta swapnavabodhasya yogo bhavati dukhaha. Thank you. I would like to take questions, if any, by the audience, or you can write it because I think I have 2-3 minutes left. Or you can write it and in the chat box and we can answer it. I think we can go ahead with the next talk.
If there are no questions, I think we'll proceed. Yeah, so I will share my screen
Smriti,
again.
can you introduce Anuja?
Smriti, yeah, so I have just put this slide in my first present, this thing itself.
So
You
you
can
can just, yeah, I'll just
you
click
can
on that.
just, yeah, so you can just show that. Just a sec. Yeah.
So Dr. Anuja Pethe is the medical director of Pan Mumbai chapter, along with myself and Dr. Sharang. We also have Dr. Rupa, who's our chairperson of the Mumbai chapter of Pan India. She's a consultant pediatrician of Nanavati, and we both are fellow lifestyle medicine physicians, have done the diplomate of IBLM together. She has been specializing in preventive pediatrics, management of children and adolescents, and she really works with the whole food plant-based consultants. She leads the parenting workshops. Her plates are so tempting. Her culinary medicine, we all always keep taking cues from her ideas of how to curate beautiful meals, especially for the children in our house. And it's always a pleasure to hear Dr. Anuja. Over to you.
Thank you, Smriti, so much for that introduction. Hello, everyone. So today my topic is going to be on decoding the evidence for our diet. So I will be taking you through good quality observational cohort studies as well as a few randomized controlled trials, because as doctors, physicians, and surgeons and consultants, we want to first understand what evidence we have about a certain eating pattern, and only then we have the confidence to implement it on ourselves. And then once we make those changes, we have the confidence to prescribe it to our patients. So to understand that, let us see what evidence we have for a healthy eating pattern. I will be taking you through multiple chronic conditions, and we will be looking at each study for these same. So when we look at these multiple chronic lifestyle conditions, there are these 2 studies which are cohort observational studies. The Nurses Health Study was started in Harvard Medical School and then included many hospitals in the United States. It was primarily started to look at the health of women and how lifestyle factors affected their health outcomes. So here in the nurses' health study, we will be focusing mainly on the nutrition aspect, although they studied many other factors. And because of a long-standing cohort nature of the study, it has influenced recommendations of the American Heart Association, of American Cancer Society, and many more. So when it comes to the nutrition-specific findings, when it comes to obesity will increase the risk for a lot of chronic conditions, including breast cancer, coronary heart disease, stroke, colon cancer, as well as cognitive degeneration and eye-related disorders. So when it comes to diet, red meat was seen to increase the risk of breast cancer. Red meat, refined carbs, and trans fats were also known to increase the risk of coronary heart disease, and red meat and processed meat also increased colon cancer risk. But what was protective was a Mediterranean eating pattern, that is prominent fruits and vegetable predominant diet, along with fish, which is mainly for healthy omega-3. Nuts and whole grains were protective against coronary heart disease and stroke. Vegetables, which are rich in folate, B6, and along with calcium and vitamin D, was protective against colon cancer. And calcium vitamin D again was protective against hip fractures. Green leafy vegetables were preventing cognitive impairment, and antioxidant rich foods, that is again fruits and vegetables, and fish for omega-3 was helpful in delaying age-related macular degeneration. So clearly a pattern has started evolving that refined carbs, trans fats, red and processed meat is harmful for us, whereas a fruit and vegetable predominant diet with whole grains, omega-3 is helpful for our health. Another cohort study was the EPIC Oxford study, where they studied the eating patterns and the health status of the population. So they divided the population into meat eaters, fish eaters, vegetarians, and vegans. And the mean fat intake was kept below 33% of the total energy intake, which was according to the UK dietary reference. And they looked at the risk of maybe various chronic conditions in these populations. And they found that the meat eaters ended up consuming maximum saturated fat, that is 10 to 11% of the energy, whereas the plant eaters or the vegans consumed only 5% of the energy from saturated fat. Also, the risk of type 2 diabetes, prediabetes, and an impaired lipid profile as well as cancer was highest among the meat eaters, whereas the vegetarians and vegans had a lower risk of everything, including diabetes, prediabetes, and cancer. Now let us look at cardiovascular diseases, hypertension, and cholesterol. So there are multiple studies. I have just picked up a few for us to understand, which focus on how nutrition affects cardiovascular health. The DASH diet study was conducted to understand how diet benefited hypertension. So this was a randomized controlled trial. They divided 450 participants into 3 groups. One was the control group, which ended up having a standard American eating pattern, that is 35% fat and 14% saturated fat. In the second group with fruits and vegetables with a little lesser saturated fat, 12%, and a combination diet group which had fruits, vegetables along with micronutrients, potassium, calcium, magnesium, and saturated fat was even lesser in them, 7%. And they found that the combination diet reduced BP compared to the other 2 diets within just 2 weeks, and the changes persisted for further 6 weeks. And this was independent of any weight loss in the participants or whether they were physically active or not. So the DASH diet study gave rise to the DASH eating plan. DASH is dietary approaches to stop hypertension. And that suggests that we need to eat more of vegetables, fruits, and whole grains. We need to have more beans and nuts in our eating, but we need to cut down on fatty meats, full-fat dairy products, tropical oils, sugar-sweetened beverages, and sweets. And also, when the sodium amount was restricted to 1500 milligrams, that translates to about 3/4 teaspoon of table salt per day per person, it lowered the BP even better than 2300 milligrams of sodium. So for us, practically, we need to try and limit our sodium intake to about 1 teaspoon per day. Then coming to the Harvard Health Professional Follow-up Study, this was like a parallel study to the nurses' health study. So in the health professionals follow-up study, they studied effects of lifestyle factors on men's health, especially the nutritional factors. And they found that when sodium was limited and potassium increased, the men had better cardiovascular health. When they had more phytoestrogens, which is through plant foods such as soybean and soybean products, it led to reduction in all-cause mortality. Also, avocado and whole grains were protective against heart diseases. A healthy plant-based diet, that means it consisted of whole fruits, whole vegetables, whole grains, beans and legumes, plant seeds, and nuts, increased the wellness as well as reduced the risk of heart disease. It was inversely associated with coronary heart disease, but a unhealthy eating pattern, even if plant-based, was positively associated with increased heart risk, which showed that sugar-sweetened beverages and refined carbohydrates were not good for heart health. Also, red meat, when you replace that with plant protein, the coronary heart disease risk dropped substantially by 14 to 17%. So, animal fats and margarine need to be reduced in our diet when we want to improve our cardiovascular health. This is the intensive lifestyle change, lifestyle heart trial by Dr. Dean Ornish, which Dr. Smriti has explained in her previous talk. This was a randomized controlled trial where he took 48 patients and divided them into two groups. These patients had moderate to severe coronary heart disease and they were not taking any lipid-lowering drugs. The intensive lifestyle change group was given a low fat. The total fat percent was restricted to 10% of the energy intake. It was a whole food, plant-based eating pattern, regular aerobic activity, stress management, smoking cessation, and group psychological support, whereas the control group was treated as per the AHA guidelines. And he found that those who adhered to the intensive lifestyle change found that their coronary atherosclerosis had regressed at 1 year and it continued to regress at 5 years. So the intensive lifestyle change group had better coronary artery diameter and the standard group had worsening of the coronary artery diameter at 1 year, which continued to worsen at 5 years. Also, the cardiac events in the form of MI, strokes, and cardiac-related deaths, they were double in the control group, whereas they were less than half in the intensive lifestyle change group. So this trial by Dr. Dean Ornish became so important that now his program is included under insurance cover in the United States. Dr. Caldwell Esselstyn is also another cardiologist who enrolled patients into his program where he treated his patients with healthy plant-based nutrition along with the conventional management that is needed as per his cardiology assessment. And he found that those patients who were enrolled into the plant-based eating program did not have any cardiac events up till a 12-year follow-up. And their cholesterol reduced substantially and they had improved angiograms over the course of years. These are a few examples of the improved angiograms that he found in his patients. The right coronary artery on a plant-based eating of 60 months has improved 30% improvement, whereas here the blood vessel has beautifully opened up on 32 months of plant-based eating. Then this is OmniHeart trial, which is the optimal macronutrient intake trial for heart health. They studied the macronutrient that was important for heart health. And here they wanted to study carbohydrate, protein, and unsaturated fat intake and to see the risk of heart health in the participants. So they chose 164 participants with pre-hypertension or stage 1 hypertension and put them on a eating pattern based on DASH eating pattern with same calories. So to maintain the calories, they had to also include desserts, that is the refined carbohydrates in the eating patterns. And then they found that those on a protein and unsaturated fat-rich diet reduced their 10-year estimated coronary heart disease risk substantially compared to the carb-rich diet. So makes sense to reduce our refined carbs. But there is also an additional trend
Anusha,
where
can you
we
just
see
go onto the presentation mode?
Okay, this is better. Yeah, Sharon, this is better.
Not yet seen. Yes, now it's.
Yeah, okay, all right. My bad. So when it came to the macronutrient, when we cut down on refined carbohydrates, our heart health is going to benefit. And so the OmniHeart diet showed us that we need to improve fruits and vegetables in our diet, but reduce refined grains and reduce the full fat foods. But because of this understanding, there is a increased preponderance of people towards a low carb diet, thinking that all carbs are bad. But this was one study done in young adults, known as the cardia study, where they put people on a low carb diet. They divided them into a plant predominant low carb diet and an animal based low carb diet. And they did the coronary artery calcification study for these patients. And they found that those on an animal based low carb diets had a progression in the coronary artery calcification. Whereas those on a moderate to low carb diet, but on a plant predominant eating pattern, had no such progression. So it is important to understand that low carbs diet is not beneficial when you include animal protein to reduce the carbohydrate content. Dr. McDougall also had this 7 days program where he allowed participants to eat ad libitum, and he gave them low fat, high carbohydrate, but complex carbohydrate, whole food, plant-based eating pattern. And he found a remarkable improvement in their biomarkers for coronary vascular disease as well as type 2 diabetes. He found that the participants lost 1.4 kg weight in just 7 days. Their cholesterol improved, their systolic and diastolic BP reduced, and their cardiovascular event risk reduced from 7.5 to 5.5%. So this was just in 7 days. So on a consistent plant-based, whole food, plant-based eating pattern, we definitely see a lot of improvement. Now, the Preventive trial was conducted to understand whether there can be a prevention of cardiovascular disease possible by a certain eating pattern. So they took 7,400 odd people. These people had no pre-existing coronary heart disease, cardiovascular disease, but they were at a high risk. That means they had either type 2 diabetes or at least 3 of the following high risk factors. That is, they were smoking or had hypertension, had high LDL or low HDL, were either overweight, obese, or they had a family history of premature coronary heart disease. So in these high risk individuals, they put them on a 3 different type of eating pattern. One is the Mediterranean diet with olive oil. Another was Mediterranean diet with nuts. And the third was a control group. And they found that those consuming the Mediterranean diet had 30 to 28% reduced risk of major cardiac events. That means MI, stroke, and cardiac related deaths. So what is a Mediterranean diet which is helpful to prevent progression of cardiovascular disease as well? It is nothing but fruits, nuts, vegetables, whole grains with moderate olive oil or nuts. They take moderate intake of fish and poultry, but that is mainly for omega-3, the fish, and they do have a very low intake of dairy products, red meats, processed meats, and sweets. When it comes to obesity, these 2 trials also were very important to understand the role of diet in obesity. The broad study, which was conducted in New Zealand, was a population-based study where they put the community on 2 different eating patterns. One was a standard healthy eating pattern, and the other was a whole food plant-based eating pattern with B12 supplements. These people also had twice weekly meetings to remain adherent to it. And they found that these participants at the end of 6 months had a drop of 4.24 in their BMI, and also their cholesterol reduced. So in 6 months itself, a whole food plant-based eating pattern was responsible for reduction in a BMI in a healthy way. Dr. Kevin Hall also conducted multiple metabolic ward studies where he studied obese individuals. While keeping the calories same, he gave one group a low-fat diet and he gave the other group a low-carb diet. And he found that those on a low-fat diet lost more weight compared to the low-carb diet group. In 2019, he conducted a similar experiment with the ultra-processed food group, whereas a whole food, unprocessed food group. And the participants consuming ultra-processed foods ended up gaining 0.9 kg in 2 weeks because they ended up consuming 500 calories more per day. And this was because the ultra-processed foods do not give you a satiety feeling. They are calorie dense, they are nutrient barren, so it is very easy to overconsume the calories. In the third metabolic ward study, Dr. Kevin Hall studied adults with an average BMI of 27.8. He admitted them and put them on a low-fat, high-carb diet and another group on a low-carb, high-fat diet. So for low-carb, high-fat, he obviously included animal-based foods because the ketogenic diet of 76% fat. And he found that those on a low-fat diet, that is a low-fat, high complex carb diet, consumed 690 calories less per day and were better on the weighing scale compared to those on a high-fat diet. When it comes to diabetes also, the diabetes prevention program looked at individuals with an impaired glucose tolerance, but they were not yet diabetic. And they put these individuals on a placebo group where they were allowed fat less than 30%, saturated fat less than 10%, and cholesterol less than 300 milligrams in their diet. A lifestyle change group where they were put on a healthy plant-based diet of 7% weight loss with physical activity, and a metformin group which was given metformin 850 milligrams twice a day. And they found that compared to the placebo, the lifestyle group compared to the metformin was twice as effective to prevent progression to diabetes among this group. Again, this is an Indian study by Sarthi et al. Where they looked at young Asian Indian adults and they put newly diagnosed type 2 diabetic patients onto a intensive lifestyle modification with low calorie, healthy, whole food, plant-based eating of 1500 calories per day with a regular physical activity, brisk walk of 1 hour per day. And they found that among the 32 patients undergoing this study, almost 75% patients had reversal or remission, that is a HbA1c of less than 6.5%. And this remission persisted over the next 2 years. So it was highlighted that a lifestyle modification with a healthy eating pattern definitely helps prevent progression and also helps remission or reversal of type 2 diabetes. Another study by Dr. Pramod Tripathi from Pune, he enrolled 2,700 odd participants in his lifestyle change program where he gave a customized vegan diet, physical activity, stress management, along with the typical medical management for type 2 diabetes. And he found that those patients who enrolled and followed the lifestyle modification were 30% of them, 30.3% went into remission. That is the HbA1c dropped below 6.5 for at least 3 months without any anti-diabetic medications. And more the weight loss, better was the remission in these patients. When it comes to cognition, this is another landmark study published by Dr. Dean Ornish in 2024, where he took individuals with mild cognitive impairment and he put them on lifestyle modification for 20 weeks. And he found that at the end of 20 weeks, the patients improved on their cognition function tests. They also improved on their beta amyloid ratio, and their microbiome also improved substantially compared to the control group. When it comes to cancer, again, Dr. Dean Ornish had this Geminal study, which looked at 30 men with low-risk prostate cancer. Now, these men were enrolled into the study. They gave a biopsy at the beginning, and then they underwent intensive lifestyle change with a low-fat, whole food, plant-based eating pattern with soya protein, vitamin E, C, selenium, regular physical activity, stress management, and psychological support. And at the end of 3 months, they underwent a second biopsy. And they found that all the participants had substantial improvements in weight, abdominal obesity, BP, and the lipid profile. But in the biopsy, they found that the gene expression had also changed. The genes which were protective against cancer had upregulated, and the cancer promoter genes had downregulated in all the participants. The serum of these men was 8 times more effective in inhibiting growth of prostate cancers compared to the control. So this shows that lifestyle changes, including a whole food plant-based eating pattern, is very, very beneficial in prostate cancer. There are multiple studies where this eating pattern has proven to be beneficial for breast cancer, for ovarian cancer, and for many other cancers as well. This was a long-standing big study, the China study by Dr. T. Colin Campbell, where he looked at populations of rural China and compared the eating pattern between those from rural China with that of the standard American eating pattern, because the kind of diseases they saw there were very, very different. Rural China did not have any chronic conditions that the Americans had. And this is a typical representation of the eating pattern. The calories were more or less the same. The total fat was much lesser in the Chinese diet, whereas it was much higher in the standard American diet. Fiber was much better. The total protein intake, although less, the animal protein was very minimal. And so we can have a pattern here that high fiber, minimal animal protein diet, low fat, which was better for overall good health. So the China study gave to summarize the findings, it is a very, very large comprehensive study, and they showed that animal proteins, when present along with carcinogens in the environment, will promote cancer, whereas plant proteins will reduce the risk of cancer. Also, the complex carbs are protective against chronic diseases, whereas the refined carbs and desserts and ultra-processed carbs are not healthy. So a whole food plant-based diet is beneficial for almost all chronic conditions, including obesity, autoimmunity, cancer, cardiovascular disease, and diabetes. When it comes to longevity also, Dr. Smriti has already talked about the blue zones, where they studied the commonalities, and among the eating pattern, they found that it is mainly 95 to 100% plant-based. It is whole, minimally processed. They have at least half to 1 cup of beans every day. Water is the preferred beverage. And they go easy on fish. They reduce eggs. They reduce sugar consumption. They reduce dairy. And they keep meat as a very, very occasional treat. So when it comes to our eating pattern, to summarize all the studies that we saw, when it comes to obesity, a positive diet change is to have minimally processed whole foods which contain complex carbs, which is low in fat, and to avoid foods with saturated fat, that is red and processed meat, and ultra-processed foods and sugar-sweetened beverages. For hypertension, we need to focus on whole grains, fruits, vegetables, and we need to cut down on the red and processed meats. To reduce cardiovascular disease risk, we need to focus on a whole food plant-based eating pattern with whole grains, plant protein, olive oil, and nuts. And we need to reduce red and processed meat. We reduce full-fat dairy. We reduce ultra-processed foods and sugar-sweetened beverages. When it comes to diabetes, a healthy weight loss because of a whole food plant-based eating pattern, which is nutrient-dense, calorically poor, is protective, whereas if you consume processed foods, animal products, and sugar-sweetened beverages, is not going to help our diabetes risk. When it comes to Alzheimer's and cancer as well, a low-fat, whole food plant-based eating pattern is shown to be beneficial to reduce the risk of Alzheimer's and cancer. With that, I would end my presentation, and thank you for a patient listening. And I'm going to stop the share, and I will introduce my next speaker. Just our next speaker is Dr. Just a sec. Sorry. Yeah, can you see my slides here, the changed slides?
Yes.
Yeah, so let me just go to Dr. Varsha's intro. Dr. Varsha is a pediatrician and a lifestyle medicine specialist. She is a professor at the SBKS Medical Institute at Vadodara. She is a medical consultant at Sharan and also at Prakriti Heal. and she is a member of ISLM, IAP, and Pan India. She is passionate about child and adolescent well-being, and she has her own nutrition institute in her medical college, where she mentors budding nutritionists for a healthy eating pattern. Over to you, Dr. Varsha. I'm going to stop share now.
Yeah. Am I audible?
Yes,
Yes.
ma'am.
Good evening. Thank you for the opportunity. I shall start, just share my presentation. Just a minute. Just a second. Is it visible?
Not yet.
Just a second. Mm. Sorry. Just a second, please. I'm sorry for that.
Are you able to see the share thing?
Yeah, I'm able to see the share. I'm actually clicking on the presentation.
Once
And
you ask for share, you can share the entire screen and not just the presentation. Maybe that.
I will share the entire screen. Okay.
Just stop share again and try again.
Yeah. Dr. Sharang, if my presentation is open, will it not be shared? Is it that way? Or I closed it, then also it's not
It can
shared.
happen if you have not shared it properly. Yeah, now it is seen.
Yeah.
Now your screen
We
is
can
seen, so
see
you
your
can open
screen
the
now.
presentation.
Yeah.
Yeah.
Is it seen now?
Yes.
Okay. Hello, everybody. Thank you, Pan, and thank you, AMC, for this opportunity. So my topic for today is hidden dangers in food. So what are the hidden dangers in food that I am going to talk about today is one is the ultra processed foods, and second is all the animal foods, including dairy products. So animal foods is going to be elaborated on by Dr. Sharang, and I will be elaborating on dairy products. So now what are ultra processed foods? As Dr. Smriti has already discussed what are whole foods, I am going to discuss ultra processed foods. So Dr. Carlos Monteiro from Brazil devised this NOVA system of classification for ultra processed foods, where we have group 1 as the unprocessed or minimally processed foods, which include fruits, vegetables, legumes, whole grains, nuts, seeds. Group 2 includes processed culinary ingredients like all your spices, salt, oil, sugar, butter, cream, honey. Group 3 includes all these canned foods, alcohol, cheese, bread, which is basically a combination of group 1 and group 2. And group 4 includes the ultra processed foods. Now, what are characteristics of ultra processed foods? They're wrapped in plastic. They're convenient or extremely ready to eat. They're made profitable with low-cost ingredients. For example, an apple is more expensive than a packet of Maggi or a packet of chips. They are constitutive of ingredients not found in your kitchen. Like, would you find red carmine color in your kitchen, or say INS 323, or a flavor enhancer? These things usually you would not find in your kitchen. They are made attractive, just because to, addict you to those foods or to attract you towards this food. Most important, when we teach children food labeling, we always say, don't look at the front label, turn the packet and learn to read the nutrition labels. They have a long shelf life. Because they have preservatives, they have a shelf life of approximately anywhere between 1 to 2 years. Why is this so? Like, for example, home fried chips, the shelf life is maximum 2 to 3 months, whereas chips in a packet would have a shelf life of 18 months. They are nutritionally unbalanced. Let's see. So it is also called as junk food. Why? Because it is digested and absorbed extremely rapidly. You eat a high amount of calories and it is digested. It hits the dopamine release in the brain. It has multiple synthetic ingredients. It is calorically dense, nutritionally barren, highly flavored, artificial flavoring used, and it is high in SOFAs, that is salt, oil, fats, additives, and sugar. So now, how are these foods processed? So we have different types of processing. First, look at this thermal processing. When you have, like steamed potatoes, baked potatoes, potato ki sabzi versus French fries versus chips, the nutrient profile changes, including the calories and the fats. So the same, this is for 100 grams of potatoes versus 100 grams of French fries and 100 grams of chips. So look at the calories increasing from 75 to almost 500 calories and the fat content going up, plus the advanced glycation end products, we will come to that. And that also goes very high in chips and fried food. Mechanical processing. So what is mechanical processing? Orange versus orange juice. So initially we saw the definition where ultra processed foods are where something beneficial is removed. So in this, the fiber is removed. And remember, fiber binds to sugar and fat and slows down its absorption. So when you eat a whole orange, you will have a flatter sugar spike as compared to orange juice. And commercially available orange juice is only sugar syrup. It has added sugars as well. Now, chemical processing is in the factory, whether it's your oil or, for example, this palm oil, it is dark in color to make it look attractive. Actually, it undergoes bleaching and bleaching agents added just to make it look good. That is true even for refined oil and refined sugars. Then we have physiochemical processing. For example, in these noodles, that refined flour or maida is extruded. So that is physiological processing, and chemicals are added to it like preservatives, taste enhancers, flavor enhancers, artificial colors to make it look more attractive and addictive. Last, we have this biological processing. Typically, it refers to fermented foods, which increases the lactobacillus or the probiotics. And it is like, for example, all South Indian food, pickles, curd, which is a good type of processing because we need those good bacteria. But today, I am going to share about a different type of biological processing, which occurs as animal being the biological factory. Almost all the animals that we consume are either fed corn or soya, and that corn and soya becomes a part of their body. And we either consume those animals or we consume those animal products like eggs or milk. So basically, it is the animal protein. So animals are just middlemen. Why don't we directly eat that protein from plants rather than getting it via animals? Okay. So what does biological processing do? It adds proteins, it removes the fiber and adds cholesterol, antibiotics, hormones, and it also removes all the plant benefits. All animal products lack fiber, which is extremely very important. There is no very less saturated fat in plant foods, and animal foods are very high in saturated fat. And these animal foods change the gut microbiome, and they also have contaminants. Now, what are the dangers of consuming ultra-processed foods? Ultra-processed foods are high in refined carbohydrates. They have excessive SOFAs, I told you, SOS, that is salt, oil, sugar, fats, and additives or chemicals. Now remember, all these chemicals act like EDCs, that is endocrine disrupting chemicals, which have a huge effect on the hormones in our body. Okay, and there are then products of high temperature cooking like advanced glycation end products, which act like pro-oxidants and cause oxidative damage to our cells, leading to chronic inflammation. Then again, trans fatty acids, which also promote chronic inflammation and cardiovascular disease. So then additives are added. All those numbers that you see in nutrition labels are manufactured in the factory to increase the shelf life. So there are various additives like food colors, preservatives, antioxidants, thickeners, acidity regulators, flavor enhancers, sweeteners, antibiotics, and additional chemicals. And remember, all these chemicals act like endocrine disrupting chemicals for the body. Okay, they are not tested on any animals or humans. So we are like guinea pigs. They are directly tested on us. So what do these foods do? They alter the gut microbiome, which are the trillions of bacteria in your gut. And the gut is connected to all the organs in your body. The gut is also called as the second heart, second brain. I'm sorry. It's also called as the second brain because a lot of hormones are produced in the gut, including serotonin and other hormones. So these ultra-processed foods are calorically dense and nutritionally barren. So Dr. Smriti already explained what is calorie density. Just look, you cannot have like 10 to 13 apples at one go. Why? Because they have a lot of fiber and you can easily overconsume a mac meal. Why? Because it lacks fiber. It does not induce satiety. So calorie in and calorie out is not the same. The 240 calories from an ice cream versus 240 calories from carrots are not the same. Each ingredient talks with your cells inside the body and nourishes them or either harms them. Now, this is just the consumption of packaged food. The packaged food industry is just growing each year with billions of rupees and profit that it is creating. Our health is not their responsibility. Now, the most important thing is processed food does to your brain. It has a very strong effect on your brain rewarding system. Okay, so the desire and the reward system, and it is involved in pleasure, motivation, and learning. So one of the pioneers is Dr. Chris Van Tulleken. He himself underwent this experiment. He consumed 80% ultra-processed foods for 4 weeks and underwent brain scanning. So you can see this brain scan, the blue lines and the red lines. The blue lines are the older connections and the red lines are the newer connections which were formed between the certain areas in the cerebellum and the prefrontal cortex. So this shows that, there are new behaviors formed which are responsible for these repetitive automatic behaviors. There was a 30% increase in the hunger hormone, and its effect is similar to taking addictive drugs like alcohol or cigarettes. And most important, the changes lasted for more than 6 weeks after the experiment ended. So what's wrong, with these all ultra-processed foods? They are not only just damaging our brain, but our body as well. So you have increased risk of all cardiovascular diseases, cancers, metabolic diseases, anxiety, depression, hypertension, dyspepsia, dementia. But most important for me as a pediatrician, it affects children the most. High ultra-processed foods is associated with higher DNA damage. Now imagine structural damage to the DNA of growing children. This is because brain growth is maximum between adolescents and young adults. There's especially the prefrontal brain growth. And there is also evidence that dopamine is particularly abundant during adolescence. So the brain rapidly learns about this reward. And it also causes DNA damage, which is heritable. Means their children also will carry those DNA damages. Okay. Then association of ultra-processed foods with cognition. Now, this was a study done in children between 4 to 7 years age who were consuming higher amounts of ultra-processed foods. And what was found out that the population which consumed higher ultra-processed food had lower scores in verbal ability and mathematical difficulties. So this may hinder cognitive development in early childhood. Then again, this is the adolescent ELDA study, which shows decreased academic performance amongst adolescents who consumed high ultra-processed foods. Now, as far as adults are concerned, this was a publication in Neurology which showed that middle-aged adults who consumed high ultra-processed foods had higher incidence of cognitive decline and stroke as compared to people who consumed less ultra-processed foods. Similarly, this paper published in the Alzheimer's journal showed that each daily serving, even one single daily serving of ultra-processed foods, raised the risk of Alzheimer's disease by 13% in middle-aged adults, and more than 10 servings just tripled the risk. So I always think that my brain is my asset, and to prevent that memory loss induced by aging, or forever the age-related diseases, especially Parkinson's and Alzheimer's, should not affect us. For that also, we should be the role models for our children and our grandchildren. So stay clear of processed foods and stop eating crap. Now, the second topic is dairy essential. So this is just a comparison between human milk and cow's milk. Cow's milk contains 5 times more protein. That's the commonest reason why we consume milk. And it contains 7 times more casein, right? Now, why casein is important? Because casein is a foreign protein, which is, in children, it may lead to allergic reactions and development of antibodies. We'll see that. And again, cow's milk is high in saturated fat as compared to human milk, and it is low in polyunsaturated fat. Now, what are the problems with cow's milk? It is not complete nutrition because it lacks fiber, vitamins, phytonutrients, and antioxidants. In children, I've commonly seen that especially toddlers, who consume more milk are more iron deficient because calcium interferes with iron absorption. And excessive milk intake leads to poor absorption of other nutrients. Cow's milk allergy, will come to that. Both cow's milk protein allergy and intolerance. Almost 70% of our population is lactose intolerant. Now, what are the other problems? It is associated with obesity, heart disease, type 2 diabetes mellitus, and due to the saturated fat content. Then it is linked to allergies, asthma, eczema, acne, atopic dermatitis, and IBS. There's increased risk of hormone-dependent breast cancer, ovarian cancer, and prostate cancers in populations consuming large amount of milk. And it does not improve osteoporosis. Most of us drink milk for strong bones. Excessive consumption is a risk factor for early onset puberty in girls and gynecomastia in boys. Milk also contains toxins, pesticides, and hormones, which also has a tremendous effect on human health. All animals are injected with prophylactic antibiotics in animal agriculture industry. 2 years back, we had an epidemic of typhoid in Baroda, where first time children who had developed typhoid had MDR, that is multi-drug resistant typhoid. How did those bacteria become MDR? Where did they get the exposure to antibiotics? Basically, when we consume milk, we are consuming those bacteria which are already MDR. Now, the most common reasons given for drinking milk are, it gives calcium for bones, proteins for vegetarians, it is a must for growing children, and Ayurveda promotes milk. So let's debunk these myths one by one. Okay. Now, this is a study which shows that, for between 1960 and 2014, it's a meta-analysis, more than 2 lakh participants, which showed no association between calcium intake and hip fracture risk, which is more as you age. Again, this article in JAMA Pediatrics showed that dairy and calcium intake did not prevent stress fractures in female adolescents. So bone health is not equal to calcium alone. It requires vitamin K, vitamin D, exercise, which is extremely very important, protein intake, fruits and vegetables, and of course, dairy itself. Remember, only 1/3 of the calcium from milk is absorbed in our body. The influence of vitamin K leads to enhanced bone mineral density and reduced fracture incidence, but similar benefit is not found with vitamin K supplements. Again, in this journal of osteoporosis, exercise stimulates osteoblasts and improves bone density, improves balance, lesser falls, and lesser fractures. This is a meta-analysis of RCTs which shows that the exercise effect on bone mineral density, especially in senior citizens, which shows increased lumbar spine and femoral neck bone mineral density in older adults. Similarly, this publication in Bone shows that exercise and fitness have a more favorable effect on BMD rather than calcium. So any calcium intake more than 500 milligrams per day has little, if any, effect on bone mineral density. Then fat-soluble vitamin D3. Excess body fat absorbs more D3 and less D3 in blood. So obese people need higher D3. And we have already seen Dr. Anuja say that all research consistently show that those on a plant-based diet have lower BMI and need less D3. Okay, this is the same study which shows that higher vitamin D significantly lowered the risk of stress fractures. Now, for proteins, proteins also increase bone mineral density, but when you double the protein intake, it can cause a 50% increase in urinary calcium excretion, especially if that is animal protein. This causes, whenever you have excess dairy intake or excess animal protein intake, it leads to a subtle state of metabolic acidosis. To neutralize that, calcium is leached out from the bones. And this would lead to bone resorption and potentially to osteoporosis. Again, higher animal protein, higher rapid femoral neck bone loss and hip fractures. Whenever the intake of animal proteins decrease, the risk of hip fractures decrease only if calcium intake was more than 800 milligram. If animal proteins intake is increased, the risk of hip fracture if calcium intake is less than 800 milligram. So that protective effect is lost. So the more animal protein you take, the higher is the calcium requirement, right? Those consuming more animal proteins need more calcium. Now, this was a survey done in 87 surveys done in 33 countries, which showed that animal protein intake actually increases hip fractures as compared to plant protein intake. Greater intake of fruits and vegetables is associated with greater bone mineral density. Similarly, this was again a part of the China study where seniors, men and women on a plant-based diet require lower calcium as compared to their Western counterparts. So if you are on a plant-based diet, you will require lesser calcium. Okay. Now, this again is a study which shows that lactose tolerant patients had a higher incidence, 80 times more higher risk of osteoporosis as compared to those who were lactose resistant. Now, this was a paper published in NEJM on milk and health, which was a review article which showed that countries consuming the highest dairy had the highest incidence of hip fractures. Similarly, this was a study in JAMA Pediatrics which showed that each additional glass of milk per day intake during teenage years was associated with 9% higher risk of hip fracture in men. So, increasing milk intake does not protect you against hip fractures. Now, we have seen that the RDA for calcium is actually 500 to 700. Plant-based diets reduce calcium needs, animal proteins increase calcium needs, vitamin K and D are also needed for good bone health, and exercise is the most effective way of increasing BMD. Now, if I'm not drinking milk, from where do I get my calcium? All legumes, nuts, seeds, and vegetables have high calcium. 100 ml of milk has 120 milligrams calcium. 2 teaspoons of sesame would give you that 120 milligrams. So like 100 grams of milk, 120 milligrams of calcium versus 100 grams of sesame, almost 1000 milligrams of calcium. That is what you have to remember. Now, proteins for vegetarians. Now let's look at milk and milk products. They are higher sources of proteins, but you have to look at the whole package. They come with higher saturated fat. And we know that saturated fat is the driver for hypertension, chronic disease, and dyslipidemias. So it is not only the proteins, you have to look at the saturated fat. The ratio is almost 1:1 in these foods. So plant foods give a very good source of proteins. Like all lentils have proteins anywhere between 18 grams to 50 grams. So all legumes, pulse, dals, lentils are a very rich source of proteins. Now let's see the difference between tofu and paneer. Both are good sources of protein, but look at the calories. Paneer has 85% more calories, almost 1000% more of saturated fat, and practically all plant-based proteins don't have any cholesterol, whereas all animal products are full of cholesterol. Now, why am I showing this? I have a lot of young adolescents who go to the gym and they're advised to have paneer and protein powder. Now, you have to remember that paneer comes along with the calories and saturated fat and cholesterol. So, even if you have to burn that, remember you cannot outrun a bad diet. Why? Because when you exercise also, heavy gymming leads to release of free radicals and oxygen species, and you have antioxidants only from plant-based products. So there are multiple better options for vegetarians. Now this is must for growing children. That's the third myth. We already know that 3 out of 4 Indians are lactose intolerant. Okay, higher protein intake in infancy and childhood is associated with higher BMI and higher obesity, which we are seeing in children. I'm seeing pre-diabetes at the age of 10 and 12 years related to obesity, hypertension at 15 and 17 years, and diabetes in young adults like 20 and 25 years. Okay, cow's milk protein allergy. Basically, it's the casein and the cow's milk protein which induces allergy, right from infantile colic to recurrent abdominal pain to allergic rhinitis to asthma. This is correlated with a huge host of allergic problems. Even chronic recurrent cough. The moment we omit dairy products, we see tremendous improvement. Okay, skin issues like atopic dermatitis, acne, eczema, and even for that matter, psoriasis. The moment we remove dairy, we see huge benefits in symptoms, recurrences, and relapse. Now, type 1 diabetes and cow's milk protein has, especially if it is introduced before 6 months of age, there is some cross-linking. There are antibodies developed to that insulin, bovine insulin, which cross-react and cause damage to the beta cells of the infant. Beta cells of the pancreas in the infant. So a lot of studies are there where intake of cow's milk is linked with higher prevalence and incidence of type 1 diabetes. So children will be better off not taking dairy. Again, milk is associated with premature aging. We know that telomere length is associated with aging. So it causes shortening of the telomeres, premature aging, and skin wrinkling. Now, Ayurveda promotes milk. So this is Dr. Nitin Kochar again from Mumbai. So this is what the Ayurvedic text says. This is in Sanskrit by Charak Acharya ji, which was in the 16th century. You do not drink milk if calf is less than 1 year old, calf has died early, calf has not grazed in sunlight, the cow has not received fresh air and clean water, cow has been milked in the morning time, and milk is not fresh and warm. And remember, just now with animal agriculture, where the cows are tied throughout the day, the calf is immediately separated. These criteria are not fulfilled. And plus, cows are giving artificial vitamins, probiotics, and cattle feed. There is artificial impregnation. A host of antibiotics are given. So milk is concentrated with a lot of these hormones, toxins, and IGF-1. Basically, milk protein promotes the release of IGF-1. Now, that IGF-1 is linked with cancer. Because of the branch chain amino acids in milk, it produces more IGF-1. IGF-1 stimulates the proliferation of normal cells and cancer cells. So it is associated with the risk of hormone-dependent cancer, specifically breast cancer and prostate cancer. So this study from the American Journal of Clinical Nutrition, the risk increased rapidly when increasing milk intake from 0 to 100 to 200 grams a day. So this is what we think we are drinking milk for strong bones, calcium, overall health and protein. But actually drinking milk increases your osteoporosis, risk of cancer, GI upset, acne, inflammation, and in children, a lot of host of other issues and hormonal problems. So what is the take-home message? Milk is not an adult food. Remember, milk is produced by any female mammal only. It is not that the cow produces milk lifetime. All mammals produce milk for their young ones. It doesn't give anything extra that we cannot get from plants, whether it is calcium or whether it is proteins. Actually, it is harmful for human, animal, and planetary health. So I end my talk with this quote: every time you eat or drink, you are either feeding disease or fighting it. Thank you. I think we have 5 minutes left. If we can take any questions, if there are any. There are none in the chat box. Any questions from the audience?
Yeah, any questions? You can just ask or type in the chat and we will take it.
While they are typing, we can just move on since
Yeah,
we're
so I
already
think
ahead
I'll,
of time.
yeah. So we'll move on. I'll introduce the next speaker, Dr. Sharang Vartikar. Dr. Sharang is a leading retina specialist in Mumbai and Thane. He is attached to Jupiter, Fortis, and many other premium hospitals. And he has many publications in international journals, has contributed to global ophthalmology textbooks. He's an award-winning speaker, and he is presently Mumbai director for Pan India. And he has a passion for a healthy lifestyle, a vegan, whole food, plant-based, holistic lifestyle, along with exercise and other lifestyle pillars. And he is a wonderful speaker, and at each one of our CMEs, we get a lot to learn from him. Over to you, Dr. Sharam, for the next talk.
Thank you, Anunja. That was very kind of you. I'll just share my screen. Yeah, I hope my slides are visible. Hello?
Yes, perfect.
Yeah, okay. So, I have, are they changing? You're able to see the images, right? Sometimes they get stuck otherwise.
Yes,
Yeah,
they're
yeah.
changing.
Yeah, okay. So I've been on a plant-based diet for past 7 years now, but still, in spite of the benefits that I've got out of it, every time I meet somebody, the first question is, where are you getting your proteins from, right? Thankfully, there are other plant-based animals who are not asked such similar questions. We just take it for granted. So what is this thing about proteins and how can we build our health without causing any harm? So that is what I'm going to discuss today. So proteins, as we all know, are complex molecules made of amino acids, like chains of amino acids. And the way it is differentiated from carbs and fats is that proteins contain nitrogen, which is not there in the others. Which is why plants are the true producers of proteins, because they are the only ones that can assimilate nitrogen from the soil and actually create amino acids. All animal proteins, whatever we consume also, are actually second-hand proteins. Okay. So when we eat food, the protein in the food gets digested into amino acids, which are then absorbed. into what is known as a free amino acid pool. Now, this pool is just 1% of the total body protein that we have. Okay. So it's not really a storage thing. So proteins are not stored in our body. Okay. Their excess is either excreted in the urine or stored as fat. So that's an important point we should remember. And from this pool, the amino acids are taken out and used for the formation of antibodies and enzymes and hormones, and of course, muscles. Now, muscles can also act like what is known as a labile storage, okay, for lack of any actual storage. So, what happens is muscles are actually the lowest hanging fruits because they're the least utilized today. We've become so, sedentary in our lifestyles that whenever there is some protein deficiency, the body would like to take the amino acids from the muscles by breaking down the proteins. And this protein, what happens is, gets added to the amino acid pool and goes into a recycling mode. So the body proteins are degraded into amino acids, and those same amino acids are reutilized to form the body proteins. This is known as the protein turnover. And per day, as much as 250 to 300 grams of proteins are recycled in our body. That is a huge amount. And this is an effective mechanism for balancing our proteins in the body. There was this randomized control trial done with a high protein and a low protein intake, and they found that a low protein intake did not actually lower the basal muscle protein synthesis rates, which was interesting, which means that we probably have enough protein to maintain our muscle mass. The question is then why to eat proteins at all? Which brings us to the first question, how much protein do we really need? So let me ask you a question. Who will need more dietary protein? Okay. A healthy sedentary male, a healthy sedentary female, a healthy active male, or a healthy active female? Well, the answer is that all will need the same. Why? Because proteins are a little different from carbs and fats. See, carbs and fats are energy providers, right? So their requirement depends on our caloric needs, and our caloric needs depend on our age, gender, and activity levels. Okay. But proteins are not primarily energy providers. In general, they contribute to just about 5% of the energy, which is not much. But what is happening is we are constantly losing protein from our body in the form of skin, nails, hair, sweat, urine, and feces, which is unavoidable, which is why we need to take our dietary protein to replace these unavoidable losses. Okay. And this is decided by the body weight of a person, which is why protein needs are given in grams per kg per day. Okay. It is interestingly not affected by age, gender, or even physical activity. There is a caveat to it in elderly and athletes, which we'll look into a little later. And that is why these meta-analysis of nitrogen balance studies have shown that the average requirement is actually just 0.6 grams per kg per day, which means 50% of the population probably will do just fine with even less than this, somewhere around 0.5 as well. But we can't take that chance. So we go for the recommended daily allowance, which is like 2 standard deviations above the mean. And that will cover almost 100% of the people, which comes to around 0.8 grams per kg per day. Right? That is why an RDA of say around 54 grams per day for a person weighing 65 kg should be sufficient regardless of physical activity of gender. That's what the ICMR says. Now, a healthy person, suppose he puts on 15 kgs of weight. Now the protein requirement will not increase actually, it will remain the same. Why? Because it is decided by the ideal body weight of a person, not the actual body weight. Because we don't need to provide proteins for excess fat that we are carrying around. So based on your height, there is a certain ideal weight that we should be having. And based on that, you can calculate our protein requirements. So an average Indian who is like 5'8" in height should ideally weigh 65, no matter how actually he weighs. And around 1 gram per protein kg per day will give us requirement of 65 grams per day. But these studies are based on nitrogen balance, calculating how much nitrogen is put inside the body and how much is being lost. So many feel that this is not the best way to calculate. And then they have come up with new studies based on the indicator amino acid oxidation, where phenylalanine is used to calculate how much protein you give to make it into an excess. And that is when you find the matching point. Let's not go into the details of that. But overall, based on these studies, they have found, especially in the elderly patients, that their requirement is 1 to 1.2 gram per kg per day. So this 0.8 is now considered as bare minimum, and 1 to 1.2 is probably more optimum. So let's say 1 gram per kg per day is what everybody has to target. Okay. The next question is taking more protein better? Okay, fine. We have got what is the minimum required. Why not take more? Well, multiple, systemic meta-analysis of randomized control trials have shown there is some modest benefit for reductions in body weight, fat mass, and triglycerides when you increase the protein intake. Even larger meta-analysis, 74 RCTs compared, they found non-significant effects with no significant dose response with higher protein intake. On the other hand, they also warned to be careful against harms. So, what is this other side of the story? Because more protein is not necessarily better, and overconsumption may lead to health problems. So, this was another paper where they checked what happens when you exceed the RDAs, and they found that there could be some issues in the body. And this is a Cochrane study, okay, the highest kind of database that you can take as far as reliability of the results are concerned. And they found that in pregnancy, those who have a high protein intake end up having with greater risk of small for gestational age babies. Babies that consume higher proteins end up having higher BMI and body fat percent when they are children. And adults have an increased risk of mortality and risk of diabetes, cancer, and heart disease, especially if the proteins are coming from animal sources. Okay. While the effect on kidney is not as much with higher protein intake, what is more important is high protein diets may be associated with a number of metabolic complications that may eventually be detrimental to kidney health. A doubling of protein intake was found to cause a 50% increase in urinary calcium excretion. So that again is an issue which can potentially lead to osteoporosis. Now, recent studies have shown that a reduced protein intake or a low protein, high carb diet may play a critical role in longevity and metabolic health. Plus, there is an increased risk of all-cause mortality with total protein intakes of over 20 to 23% of the energy coming from proteins, which roughly equates to 1.6 grams per kg per day. Consuming a very high protein intake, again, exceeding 22% of daily calories, which means 1.6 grams per kg per day, from protein can negatively impact cardiovascular health. So the jury is out. Most agree that the bare minimum we should take is 1 gram per kg per day. That's around 12% of your energy coming from proteins. A safe maximum is now considered to be 1.6 grams per kg per day. Beyond that, things get a little dicey. So moderation is the key. You can't just keep obsessing and consuming proteins without an upper limit. But the question is, aren't Indians protein deficient? Because if you type on Google this very question, you will get multiple articles which will show that there's a huge protein problem in India, right? And that is why the market for proteins is going on booming like anything. And this is what is happening. Every product is now, there is extra protein added to it to make it so-called healthy. And it's selling like, anything. So we don't know what's expected next. You may get all kinds of products with extra protein just because it sells better. But where's the data for all this? So if you look at the sources that these articles have given, you will find that most of them are linked to each other. So it's like a bhul bhulaiya where you can, you have to come out of it and find one source. And this source, most of them refer to, is this study which was done on 1,200 odd people for a population of 150 crore, and they concluded that 90% of vegetarians and 85% of non-vegetarians were protein deficient. So I was curious to understand how they did the whole survey. And this is the entire paper with no mention of the, how the dietary intakes were taken or what were the protein sources. Nothing is mentioned. And then when I looked at the author, is a certain senior manager of Nutricia, which actually sells Protein X. You can't just take it at face value, right? But is there no protein deficiency? Well, absence of evidence is not evidence of absence. So let's look at more reliable and unbiased data. Now, this is from the NIN, the National Institute of Nutrition, across multiple states, multiple times, right from 1975 to 2005 studies they have shown in this paper. And interestingly, if you look at the weight and the mean protein intake, you'll find that Indians on an average have been consuming 1 to 1.3 grams per kg per day. And that is in spite of the fact that majority of the proteins are coming from cereals, which are lesser in protein as against legumes, which are higher in protein. This is a very recent survey, which showed that on an average, Indians are getting, whether rural or urban, around 68 grams per day. So the primary bottleneck, what they identified, is actually energy inadequacy, if at all, and not just the protein. And consumption of pulses and legumes, which are important sources of protein, was less than 50% of RDA. So I'm going to give you some key takeaways as we go along. The first key takeaway is that calories should be adequate. If you're not consuming enough food, you'll obviously not get enough protein either. So that's the first thing we should understand. So we are not like as bad as the whole scene is made out to be, but yes, there is scope for improvement, and which we'll look at a little further. Because the next question is, can we get enough protein just from plants? Okay, so let me explain this with an example. So you have a 5'8" height person who ideally is weighing 65 kgs. So the daily protein requirement would be around 65 grams per day. Now, because he's 35-year-old male sedentary, the ideal caloric intake should be around 2200 calories. Okay, now 1 gram of protein will give us 4 calories. We know that. So if you are consuming 65 grams of protein, then 260 calories of your diet should come from proteins. Okay, that means you will get your 65 grams. Now 260 of 2200 is roughly 12%. So any diet, okay, and this is known as the protein energy ratio. How much percentage of your energy that you're consuming is coming from proteins? That is the PER. So any diet of 2200 calories with a PER of more than 12% will provide adequate RDA for proteins, right? Now, based on PER, a food is called a source of protein if PER is more than 12%, which is what we saw. So any source of protein, if you keep eating, you will get your RDA. On the other hand, there are high protein sources, because there will be some which are low protein sources. Then you have to balance them with high protein sources if the PER is more than 20%. Now, if you look at grains, you will see that they are somewhere between 12 to 20. So they are all sources of protein. Nuts and seeds again have a PER between 12 to 20. So they are also sources of protein. Vegetables, in fact, are high protein sources because they have a high PER. The problem is they are very low in calories, so you can't eat too much of vegetables to cover up the protein numbers. But legumes are not only having more in calories, they are also high in PER. They are excellent protein sources. And that is why varied diets containing vegetables, beans, grains, nuts, and seeds will have no difficulty in obtaining enough protein from a regular diet, but we need to have an appropriate combination of cereals with pulses. So a right ratio. We saw that Indians consume a lot of cereals. We are cereal heavy diets. Okay. And legumes we are just not eating. So that ratio has to change. And we need to eat whole foods. We had excellent talks just now where we are seeing that the shift is going towards processed foods. So that has to stop, and we have to go for the whole foods. They will give you the actual nutrition, not the processed stuff. Okay, so we can get enough proteins from plants as well. But isn't meat a better source of protein? Because if you compare the two, meat will give a lot more protein, almost 2 times what you can get from plants. We need to remember though, that again, our body cannot store protein. Okay, so what is going to happen with this excess protein? And that is where we look at the evidence. And I'm going to restrict this evidence to papers which are actually comparing animal protein and plant protein. I'm not looking at all the other benefits which already have been shown by Dr. Anuja and Dr. Varsha Shah, where as a diet, how it is better. But I'm restricting to articles where only proteins have been compared. And they found that intake of animal protein related to promotion of age-related diseases, while a low animal protein diet may provide health benefits. When it comes to diabetes, they found an association that total proteins and animal proteins increase the risk of diabetes, while plant proteins reduce the risk of diabetes. When they replace animal proteins with vegetable protein foods, risk of diabetes reduced significantly. As far as mortality is concerned, studies have shown that animal proteins increase the risk of cardiovascular mortality, while plant proteins reduce the risk of cardiovascular and all-cause mortality. They also did a substitution analysis, and for both cases, they found that replacing just 3% energy from animal proteins with plant proteins gives a lot of benefit. In hypertension, animal proteins have found to increase the risk of hypertension in elders, while plant proteins have found to reduce the risk of hypertension. When it comes to kidney disease, again, animal proteins have shown to increase the risk of CKD. Right? What about bone health? Dr. Varsha Shah spoke beautifully on that. It is the high animal to plant protein ratio which increases the risk of bone loss and fracture. This survey she mentioned, higher the protein intake, animal protein intake, greater is the risk of fracture. Higher the vegetable protein intake, lesser is the risk of fracture. Now, high protein diets have been promoted for obesity. See, if you replace refined carbs with proteins in your diet, you will definitely get benefits. So, whether it is the excess protein that is helping or whether it is elimination of the bad things that come along with a diet that is helping, that nobody knows. And which is why a plethora of studies have shown to lack any conclusive evidence in favor of high protein diets. In fact, forget protein, no individual nutrient has been found to be a friend or foe when it comes to weight loss and its maintenance in the long term. Why? Because the importance is of dietary adherence rather than which macronutrient you are looking for. That is the success for long-term weight loss. And that is why now more and more countries are recommending people to shift towards plant-based alternatives, which is what is known as a plant predominant dietary pattern. But that's not all. When we eat food, right? Not just proteins. Nobody like picks out proteins from a food and eat, which is why we need to look at the complete package. Animal foods also give us saturated fats, trans fats, and cholesterol, but they also have various toxic and inflammatory products, right? Like heme iron, which has been linked to increased risk of colon cancer and cardiovascular disease. Heterocyclic amines, they have been linked to neurotoxicity, myocardial toxicity, diabetes, and even cancers. Nitrosamines, carcinogenic and teratogenic. Neo-5-GC, highly inflammatory, leading to cancers and atherosclerosis. Advanced glycation end products have multiple effects on various organs of our body. PMAO has been shown to have an increased risk of mortality along with affecting various other organs. And of course, antibiotics. 80% of the world's antibiotics are used in animals just to make them grow faster. And hundreds of tons of cholesterol have been, pumped into the poultry industry in India. That is how bad it is. Okay, what about contaminants? Yes, they are also found in plants, but we have to understand that concentration increases higher up the food chain. So if you eat plants, you will get less toxins. If you eat an animal, you are likely to get more because of biomagnification and bioaccumulation that happens in the animal's tissue. So with animal foods, with the extra protein, we are also getting saturated fats, cholesterol, hormones, antibiotics, contaminants. Plus, we are getting various kinds of inflammatory products, which are carcinogenic, mutagenic, cardiotoxic, neurotoxic, nephrotoxic. Plus, it is increasing the risk of various metabolic diseases and a deranged gut microbiome. With plant foods, what are you going to get extra? You're going to get fiber. And a lot of people have spoken already about it, which is completely missing in animal foods. All these benefits are completely lost out. Plus, you get amazing micronutrients and flavonoids and an optimized gut microbiome with practically no risk. Obviously, you know which foods are much better. So the next key takeaway is try to get as much proteins you can from plant sources and reduce the amount of animal protein intake. The next question is, aren't plant proteins incomplete? Because everybody tends to think that. What is a complete protein? Which contains all 9 essential amino acids. And based on this, animal proteins are thought to be complete while plant proteins are considered to be incomplete. So let us understand that by a quick fact check. If you look at the various sources of foods, meat, dairy, veggies, beans, grains, seeds, and nuts, and the 9 essential amino acids, first of all, you will see that all plant sources have all the essential amino acids. Okay, this has to be made very clear. Secondly, 7 of the essential amino acids are fully adequate. So there's no worry about these amino acids at all. Only 2 are borderline. Which are those? Veggies and beans have low methionine, while grains, nuts, and seeds have low lysine content. Now, which is why it brings us to this limiting amino acid content concept based on this Liebig barrel. What does it say? That grains, nuts, and seeds have low lysine. So even if there are high amounts of other amino acids, that barrel is useless. Okay, while veggies and beans have low methionine. So again, this barrel is also useless because you can't fill the water up. And that is why they are known as incomplete proteins. And I agree with this. The issue is that grains, nuts, and seeds have high methionine, while veggies and beans have high lysine content. Exactly the opposite. What does that mean? It means that when you combine the two, you get a complete protein because they are complementing each other. So dal, chawal, sabji, roti individually are incomplete. But nobody just eats roti the whole day, do we? We always pair dal with chawal, sabji with roti, and these combinations automatically become complete, right? And that is what ICMR also says, eat them in the right ratio. That is what the one of the key takeaways which I told you. Traditionally, across the globe, diets have evolved in such a way that the plant proteins automatically complement each other. What about quality of proteins? Now, there are certain scores given. The latest is the DIAS score, the digestible indispensable amino acid score. And based on this, what is it? It is based on the lysine content of a protein source. And based on that, because we have already seen that grains, nuts, and seeds are low in lysine, they get a poor score, while vegetables and beans get a high score. Now, to understand this, let us suppose that we want to find out who's the best animal in the jungle. Okay. Now, to be fair, what we have decided is everybody has to give the same exam. What we tell our children, right? Go climb the tree is the exam, the tree test. Now, what is going to happen? Obviously, the monkey is going to be very happy, but the fish out there is going to feel bad because the fish will never be able to climb the tree. But if we judge all animals just by their ability to climb a tree, we will be declaring many animals to be worthless. Okay, the same thing is happening with lysine test. We are looking at just their ability to, content of lysine, and based on that, we are giving low scores to certain protein sources. When the fact is that combining multiple protein sources increases the amino acid score automatically. Okay, so we have to avoid such a reductionist approach and look at what is on the plate and not look at individual things that are there on the plate, which is why a balanced plant-based diet will provide quality protein that meets the requirements of all essential amino acids. So they are actually complementary. Now, what about athletes and elderly? There was a star which I had put early. So let us look into that. So the recommended daily intake for athletes and trainers is slightly on the higher side, up to 2 grams per kg per day. Now, if you look at that, it's like for 80 kg person, 160 grams per day. If you take 2 grams, that's the higher side. Can we get it so much proteins from just plant foods? Well, if you look at the diet of an athlete eats 3,500 to 10,000 calories in a day. You and I consume barely 2,000 calories. Okay, why so high? Because they actually burn the calories. We are sedentary people. Now, these are a very small category of elite people who actually burn that many calories and they consume also that many calories. So if you look at, say, 5,000 calories a day, 15% of PER will still give them 187 grams per day. That's 2.3 grams per kgs per day. Even if they just eat plant foods, 15% is not a big deal. So adequate calories will give you adequate proteins. In fact, if you see, these athletes, especially the endurance athletes, are actually on a high carb diet. It's not the proteins that they need to rely on, it's the carbs to replenish their glycogen stores, is what they are really worried about. So, for athletes, if you compare animal protein and plant protein, you will see that animal proteins are pro inflammatory while plant proteins are anti inflammatory. Animal proteins increase the blood viscosity, so make it sluggish, while plant proteins improve the arterial flexibility. Recovery is slower with animal proteins, it's faster with plant proteins. Heart health, it's linked to plaque buildup, while here it is actually associated with plaque reversals. We found Dr. Anuja had shown beautiful images of that. And fiber and micronutrients are very low or none in animal protein, while they come bundled extremely high with plant proteins. That is why there are many top athletes who believe in the power of plant-based proteins. They have been winning Olympic gold medals on plant-based proteins, and this is not something new. Athletes have been doing that since early 1900s. Another question, who is more likely to have protein deficiency? A healthy sedentary person, a healthy active person, or it doesn't matter? Well, surprisingly, the answer is a healthy sedentary person is likely to be protein deficient. Let us understand this. If you exercise more, you end up eating more. More calories means more proteins. On the other hand, if you exercise less, you're just not eating enough, not enough calories, not enough proteins. But With increasing activity, the demand for amino acids increases to a much lesser extent, if at all, than the energy demands. So the demand is basically remaining the same. So more proteins with a similar demand means no deficiency, but less proteins with a similar demand means deficiency. So exercise is the key here. You exercise enough, you will get your proteins. What happens in the elderly? Well, this was a beautiful paper, which was they studied the RDAs existing, and in the elderly, they found that there are three issues with the elderly. One, they have a reduced intake of food because poor appetite and GI disturbance. The ability to use proteins is also reduced because of insulin resistance, anabolic resistance, high splanchnic extraction, and immobility. Plus, their needs are slightly on the higher side because they're suffering from inflammatory diseases. Okay, exercise and whole food plant-based diet will successfully address all these issues in the elderly as well. Please remember, muscles are built in the gym, not in the kitchen. If you keep exercising, you will be benefited in much better ways. Give an example. If you want to grow a plant, okay, what are the important things you will keep in mind? You need to give light, you need good soil, water, air, nutrients. But please understand, the very basic thing we need is a seed. Without a seed, all these things are useless. Without a demand, giving nutrients is a waste. So our body has to create a demand for proteins. Will have some impact. So athletes and elderly are different but not difficult. Do we need protein supplements? Well, requirements are not as high as commonly perceived. Intake levels greater than 1.6 grams per kg per day have not shown to contribute any further to gains in muscle mass. Meta-analysis have shown that protein's effect on hypertrophy is small compared to the stimulus of the exercise itself. So again, we are coming back to the same point that if you look at a cake, protein intake is just the icing, while the exercise is the entire cake. Exercise is that important for us, not just consuming proteins, and which is why these poor laborers with low income see their muscles because they are exercising. It's not because they are eating proteins. So who needs supplements? Somebody who's on a calorie restricted diet for rapid weight loss. They don't want to consume calories but want to gain proteins. Seriously ill patients, bodybuilders who want to shed all possible fat right till the ounce, or everyone who keeps a higher protein target, because the moment you go into a gym, you're given this box of supplements and told to keep drinking proteins with unrealistically high protein intake requirements. Please understand, supplements are for temporary use. Okay, they cannot be replacement for meals. This is what I eat in the throughout the day. No protein supplements, no dairy, no meat, no eggs, no fish. I don't even go to the gym. It is regular home exercises that I do. And this is the kind of diet that I have. And I get adequate 1.2 grams per kg per day of proteins. In 8 months, recently, I lost 2 kgs. But I did a DEXA scan. And what I found interesting was 3.2 kg fat loss was there with 1.2 kg muscle gain. This will come not by eating proteins, but by exercising. Everything can be achieved if you exercise. So strength training, last but not at all the least, is strength training. Okay, remember this crops. Okay, calories should be adequate, right ratio, whole foods, plant protein sources, and strength training. Finally, what does the future hold? If you look at land use, freshwater use, greenhouse gas emissions per calorie or per gram of protein, we will see that animal-based protein sources are actually detrimental to our planet. Okay, 1 kg of beef protein requires more than 30 kgs of plant protein. So only a plant-based diet is actually sustainable. So to summarize, this crops, including sustainability as well, I've already mentioned. This is the plate that you should look for: 50% fruits and veggies. Okay, original, I mean raw, in the whole food format, plant proteins, legumes, and only 25% whole grains, not the entire plate as we are tend to eat. And if there's one single message from all this, how much ever protein one decides to take, plant proteins are way better for us than animal proteins, be it for our own body, for our planet, for the future of our children, or for the animals themselves. Thank you so much.
Thank you so much, Dr. Shanam, for that wonderful, wonderful talk, as usual. I hope the participants listening got to understand many concepts, got to revise or, clear many doubts, and have now a approach as to how do we look at proteins and where do we seek our proteins from. There's one question which is just unanswered, and I would ask if Dr. Rajiv or Dr. or anyone from AMC could tell it that the participant wants to know whether we get the recording of the whole session. So, Rajiv sir, can you answer that, please?
Meanwhile, any other questions?
And any other questions if any participant wants to ask? Yeah.
I guess the
Sir, could you
recording is being
repeat? I
done, so
think.
I don't know if they probably share it. I think they can answer that later on.
Yeah, all right. Anyone else? If you have any questions, we maybe can take some 5 minutes. There's a second question.
How
How
harmful
harmful
is
is
sugar?
sugar? Sharon, can you answer that quickly?
Yeah, sure. I mean, again, sugar is a highly processed food and completely refined carbs. So it has actually no place in the kitchen. There is a at all. So
Yeah, so I
best is
think I have
avoided.
answered another similar question in the chat. So role of sugar. So there is no role of sugar. There is role of glucose, which our body digests and breaks down into glucose. So we need complex carbs mainly. We don't need simple carbs, and only simple carbs from whole foods. That is your fruits and dry fruits. That is better. Um, Five. Okay, we are getting many questions. Um, do we need to register again for the
Whey
CME?
protein. There's a
Okay,
question
whey
on whey
protein
protein
powder
actually
actually
helpful.
helpful.
Yeah, so again, the same thing. It is a processed form of, it's not a food. From the milk, you are taking out just a whey protein and trying to give it. Now, the question is, why do you want to take that powdered form? That's the first thing. Like I mentioned in my talk, most of us do not need that kind of excess protein. So it's really not needed. It is the exercise that is more important. If you go to a gym, then you can just, the exercise will give you the benefit, not the consuming of protein powders. Plus, these powders which are made in a factory studies have found that they are filled with a lot of contaminants and metal poisoning is also there. So we would rather avoid that.
Yeah, one
Is it
question is
harmful
how
if
to
protein intake
reverse
is?
leaky gut and improve liver function. Sorry, there's another
Yeah.
one. Harmful if protein intake is more than 2 grams. Sharon, can you take it?
Yeah, so there are studies which do suggest that increasing your protein intake overall is also not good for the health. But more importantly, if those proteins are coming from animal food sources, that is even worse. So first thing is cut down on your animal protein intake. That's the first thing. And secondly, there's no need to try and push for 2 gram per kg per day. If you're eating a whole food plant-based diet and you are crossing 2 gram per kg, you may still be okay with it. But the whole fixation about trying to get to 2 gram per kg per day is really not required. And you need around 1.2 gram per kg per day. Up to 1.6 is considered to be safe. Beyond that, very specific populations, which I told you, may require a higher grams per kg per day. And the damage will not be immediately apparent. It will come in the form of metabolic diseases in future. So I would recommend not going beyond 2 for sure.
Okay, so this question to reverse leaky gut and improve liver function. So to reverse leaky gut is a gradual process, but when we are just talking about the nutrition aspect of it, leaky gut is because there is lack of fiber and the microbiome is imbalanced. So the bad bacteria quickly, and the fiber is actually the food for the bacteria. So there is no fiber, the bacteria start digesting the mucus lining of the intestines, and then that leads to a leaky gut. So to reverse that, we need to replenish the healthy microbiota. So our own healthy microbiota needs the food that it is required, so that the prebiotic is fiber. Again, we need to gradually increase it, because sudden increase in fiber and whole foods, a lot of people may not digest it immediately and can give rise to digestive concerns. So has to be done in a medically appropriate way. And again, to improve liver function, also we need to reduce the intake of ultra processed foods and animal products. Like we saw, the animal products contain a lot of things along with the so-called protein, which the entire package is ultimately not as healthy as a plant-based, whole food, plant-based eating pattern. So I think that is the short answer when it comes to a nutrition perspective.
There's another question where they're asking whether height is important or body weight. So the most calculations which have been done assuming that people are of the ideal body weight, okay, which unfortunately is far from truth these days. So to keep it simple, people say that okay, just take the actual body weight and you will be fine. But unfortunately, obesity is so much on the rise now that we have gone way away from our ideal body weight. So we need to get back, find out based on our height, what is the ideal body weight that we should be having. Based on that, our protein requirements have to be taken into account, not on the actual body weight. Most of the times, it may come to be similar. If you are like 4-5 kgs above your body weight, it wouldn't matter. You can take the. For those who are excessively obese, then you would be overestimating your protein requirements like crazy, which is not really needed.
Another question, Sharang, does eggs are safe when there is increased use of growth hormones and anabolic steroids?
Yeah, so animal agriculture itself has become, so dangerous with all kinds of stuffs being used in animals to get. It's a profit-making thing. So, hormones and antibiotics and stuff which are given there, it's really not a reliable source of good nutrition. If you look at the protein intake, I mean, most of the people eat eggs for proteins, right? Now, proteins, one large egg will give you around 6 grams of protein. But if you have a large katori, 200 grams of cooked dal, it will give you 18 grams of proteins. So rather than consuming 3 eggs, which will not give you anything else, because most of the people they eat, the egg white, because the yolk again has cholesterol and it has a little bit of saturated fat. So all these things they are avoiding and they are taking egg whites just for the protein. So it really doesn't make sense. I would rather go for the legumes and whole plant foods, which will not only give you proteins, but they will also give you a lot more beneficial things.
Okay, what about
Again,
vegan
vegan
meat
meat
available?
is available. Again, they are too processed. It's not something that we would recommend. See, vegan food is different from what we are talking of. We are talking of whole food, plant-based diet. Vegan is a lifestyle which wants to exclude any kind of animal exploitation. And so it's not related to health per se. So these are substitutes for those who want to not be a part of the animal cruelty, but they don't want to give up the taste of the meat that they're used to. So these things have come up. So obviously they are processed, they are tried to make to taste like the original meat so far. So I would not recommend that on a daily basis, certainly not. Maybe as a transition food, when you're trying to reduce your animal food intake, you may consume those, but the final goal should be towards whole foods and not any processed foods.
I guess, yes, that's about it. So I think we can wrap up for the day. I
Yeah,
guess
if Dr. Rajiv or Dr. Prashant is there, they can. All right, then I think we can just wrap it up.
Yeah, we can wrap it up.
Yeah.
Thank you.
So
Thank you,
thank you
everyone.
everyone for attending. Yeah, Anuja, go ahead.
No, you want to complete it?
No,
Sharon?
fine.
Yeah, okay. So thank you everyone for attending this and being very interactive. All of us at Pan India had a lot of fun here, presenting and discussing our topics, although this was online. A huge thank you to the Association of Medical Consultants Dr. Rajiv Agarwal, Dr. Prashant Kerkar, and the entire core team for collaborating and making this possible. And looking forward to the next session, which we will be having on 5th of March. So we will be updating you through AMC as well as on our PAN website and PAN WhatsApp groups. So hope to see all of you again next month, where we go deeper into the topic of nutrition with respect to specific chronic conditions. Thank you so much
And
and have a great evening.
also keep conducting these in-person CMEs also throughout the year. So be on the lookout for that. And whenever possible, do come and attend the live sessions, which are a little more fun than this. So hope to see you in person at some of these meetings that we'll be having. Thank you so much.
Thank you. Good evening and have a great evening. Bye.